Chairman Benak, we're live. Can start whenever you'd like.
Okay. Well, good afternoon. I would like to call the April 28th Board of County Commissioners virtual emergency meeting to order. We're going to go ahead and start this afternoon with the invocation by Commissioner Vanessa Boss. Father, we thank you for getting us all together today, and we pray that you will give us guidance and help us to make the right decisions to move Manatee County forward out of this pandemic. We thank you for standing beside us, giving us strength and giving us knowledge as we move forward. Father, we pray that the state of Florida, all of America, and all of the world will be able to move forward past this pandemic, as we know that you will help us get through it. In Jesus' name we pray, amen. Amen. Thank you. We're going to go ahead and now go to the roll call. John, if you'd like to call the roll.
Thank you, Commissioner. I will have Priscilla Trace.
Here.
Commissioner Bellamy.
Here.
Commissioner Johnson.
Here.
Commissioner Servia.
Here.
Commissioner Boss.
Here.
Commissioner Whitmore.
Here.
And we have Commissioner Benak as chair.
Here.
And County Administrator Sherry Courier.
Here.
And County Attorney Mitchell Palmer.
Here.
And from the board records, we have Supervisor Vicki Tessler.
Here.
And online, we also have our Public Safety Director, Jacob Sauer.
Here.
Thank you, Commissioner.
Okay, thank you. I'm going to go ahead and turn it over now to County Administrator Sherry Courier. Do you have any changes to the agenda today?
County, Madam Chairman and members of the board, I do have quite a list of changes, and we apologize. We made some additional add-ons to the agenda, but also good to read so the public knows where some of these resources are. So changes to the agenda under the administrator. Under item 1, the discussion of ongoing issues relative to the coronavirus COVID-19 emergency. The following documents were added to this agenda item and can be found online with our e-agenda. Ongoing issues related to the COVID-19 PowerPoint presentation, the COVID-19 reopening strategies PowerPoint, the State of Florida Executive Order Quick Guide, Manatee County BCC Resolutions Quick Guide, the guidelines for opening up America again from the federal government, State of Florida COVID-19 department updates, Manatee County Government COVID-19 department updates, and then any additional comments, public comments that were received by 11 o'clock this morning have also been added to this agenda. Under item 2, authorization to draft a letter to the federal legislative delegation supporting a modification to the CARES COVID Aid Relief and Economic Security Act relative to assistance for business retention and reopening. We've added a document we received yesterday, a letter from Congressman Buchanan to Speaker Pelosi and Majority Leader McConnell, and this was added in reference to this particular topic to our agenda. And under item 3, the discussion of the Board of County Commissioners meeting schedule for the period May 1 through July 31st, 2020. The latest bullet point in the background discussion was updated to read, dates to be considered for additional land use meetings include Tuesday, June 23rd, with an overflow date of Wednesday, June 24th, Wednesday, July 22nd, with an overflow date of Friday, July 24th, and Thursday, August 20th at 1:30 p.m. The BCC 2020 meeting schedule draft update was also revised to include these dates. And just before the meeting, we did include on the electronic agenda a copy of a layout that could be used at the Convention and Visitors Bureau should the board decide to meet in person following any social distancing guidelines. Thank you. That's it.
Great. Thank you. Okay. Now we'll go ahead and move on. You're going to make an opening statement, Sherry?
Today, I'm just going to go ahead and update the board that we have two presentations. One will start off from Public Safety Director Jacob Sauer will be his regular update on the COVID-19 crisis. Following any discussion or questions with Mr. Sauer, I'll be presenting to you some current status of reopening strategies on behalf of Manatee County and association with both federal and state guidelines. And so with that, I would turn it back over to you, Chairman, for Mr. Sauer.
Okay, we'll go ahead and go to Public Safety Chief Sauer. Director,
Good morning, Commissioners, or good afternoon, Commissioners, Administrator Courier, and County Attorney Palmer. Sorry, I'm pulling up my stuff here. Okay, Seth, do you have the slides pulled up? Okay, we can go to the next slide. Okay, so on this slide, as you can see on the numbers depicted on the opening slide here, and I want to make sure that I'm clear, we created these numbers with yesterday's data, wasn't available at time for us to submit early. So when I go through this, I'm going to be giving out today's data that was recently released as of the 11:30 report. So the effects of the pandemic continue to rise, and while the state of Florida appears to have hit the peak and has flattened the curve, Manatee County remains to be on an upward trajectory. And I wanted to give you a quick update since the slides were created yesterday. Like I mentioned, we do have some updated numbers. So as we go through these, I'm talking about the numbers that are recently released at the 11:30 a.m. this morning update, and the slides are reflecting yesterday's numbers. So as of today, the state of Florida now has 32,846 total positive cases and 1,171 deaths. And Manatee County has 563 positive cases with 46 deaths as of the 11 a.m. update. Next slide, please. Okay, this is just a quick bar graph to show you where we are with the EMS. EMS continues to see a decrease in overall call volume during the curfew hours when compared to the same week in 2019. The curfew ended. However, the decrease is nowhere near what it was during the actual 18 days that the county had enacted the curfew. And we expected that, and that is okay. We have seen quite an increase in EMS calls to long-term care facilities for transports and COVID-19 related incidents. The decrease in call volume during the days with the curfew was about 35 to 40%, whereas since lifting the curfew, the decrease in call volume is only around 8% now. We've also seen 44 new hospitalizations since last Tuesday. Outside of the past curfew hours, EMS has seen an uptick in COVID-19 related responses, and like I said earlier, mainly nursing homes and long-term care facilities. Next slide, please. Okay. This is some key indicators. Since last Tuesday, and when compared to data as of noon yesterday, there are a few key indicators that I'm going to provide you on how the numbers in both Manatee County and Florida have changed and can be compared. The state of Florida currently has, like I said earlier, 1,171 fatalities, and of those, 46 have been within Manatee County. Sadly, 20 of those deaths have come from the two long-term care facilities within the county. This compares to last Tuesday when Florida had 839 fatalities and 34 for Manatee since last Tuesday, an increase in fatalities of around 23% for Manatee County in the past week. With respect to positive case count, Florida has 32,846 positive cases, 563 are within Manatee County, and this compares to last Tuesday when we had 26,761, and Manatee County had 435. And that's an increase of 29% as of today's data. Last Tuesday, the Department of Health reported that Manatee County had results on 2,641 tests, and 433 of those were positive, and 2,204 were negative for Manatee County. And at that time, a 16.4 positive test rate. And when compared to the state of Florida, the positive test rate last Tuesday was around 9.9%. As of yesterday, Department of Health reports that the county has results on 3,579 tests, an increase in the past 7 days of 938 tests, or about 35.5% in performed tests. Of those 3,579 currently performed tests, the results are, again, 563 positives as of today, which is a 15.7% positive test rate. And this compares to 8.9% for the state of Florida. When the data is then broken down by current total, a 24-hour change and an average daily change over the last week, the state has trended downward or remained flat over all three indicators, whereas Manatee County trended upward in positive cases and downward or remained flat for fatalities and positive testing percentages. While the county's positive testing percentage may have gone down by 1% over the past week, which largely mirrors the trend for the state, Manatee County remains at a 15.7% positive test rate, while the state has gone down to a mere 8.9% positive test rate, meaning we're still almost 6% higher than the rest of the state. As you can see on the next slide, the case count for Manatee County continues to trend upward, while Florida has largely flattened the curve. If you look at March 31st through April 4th, that was when we received data back from the first drive-through test site. And over these dates, the trend line is then skewed upward from what is actually occurring in the community, which makes the situation seem even less severe. Next slide, please. Okay. Local drive-through testing. The Department of Health received 300 state tests on Wednesday, and another 300 of last week, and another 300 specimen collection kits on Friday of last week, for a total of 600 from the state. We are happy to report that 240 tests will be used at a drive-through testing site at the Convention and Visitors Bureau beginning April 29th, this Wednesday, through May 1st. And with 60 of those tests, of the 300 we initially got, we will continue to use for contact trace monitoring. This will be the second collection testing site with the potential for a third operation that will be initiated the week of May 4th, same dates, with an additional 300 collection kits that can be completed. We also requested an additional 500 collection kits from the state that we intend to use for a forced drive-through the following week after. And we're also awaiting plans from the state on whether they will be facilitating a state-coordinated collection site, which I'll talk about a little bit. And we've been in talks with them this week, determining a location for the state collection site that will serve Manatee and Sarasota counties, what is known as a regional site. Next slide, please. Okay. And talking to the state drive-through regional site, when we get that finalized, both Manatee Emergency Operations Center and Sarasota Emergency Operations Center has been working very closely with the state of Florida to find locations relative to both counties, somewhere in the middle around the University Parkway area, for them to set up their site. The state collection sites, when finalized, typically they operate for a minimum of 14 days, and they see about 350 to 400 patients a day. This could dramatically increase our total testing stats soon. The state also continues their regional IMT team to monitor and assess our long-term care facilities. This team is expected to test almost 700 residents within those facilities starting this week. So within the next 2 weeks, we could potentially see 1,740 test increases within Manatee County in our stats. This doesn't include the ongoing testing through MCR that's been taking place all along, or take into account this regional testing drive-through site by the state. Next slide, please. So this is a projection, and the company that puts out this projection, this has been very useful for emergency operations centers, our emergency operations center in the state. They put out projections sort of like we do when we talk about hurricanes. So they've been within their 10% margin of error, and this is showing you how the trend data is skewing for the state. And they do those in seven-day projections. And these model outputs can be used to assist us locally with our medical facilities to better prepare for an increase in hospitalizations, if that was to occur, or to plan for and locate drive-through testing facilities and determine where increased levels of transmission may be occurring. Next slide, please. Now, this is yesterday's projections through IEM that we use for our models. They are executed on a daily basis, so this is not the one that came out today. But they do evaluate the ever-changing dynamics of the COVID-19 pandemic, and their projections have typically been within the 10% margin of error, especially as we've been in this for quite some time now. And looking at the slide with the Florida counties data, it appears our county will see an increase of almost 40 additional cases by this coming Sunday, and continues to rise as we move through this. And next slide. Okay, and finally, in speaking to the local burn ban that was put in place, during the local burn ban, our drought index was, when it was at its highest, was around 616, and we want it to be very low. So with the recent rains that were pushed through this past weekend, and with more expected rains later this week, I recommend that the county lets the local burn ban lapse by not extending the ordinance that is due today. Our drought index today is hovering around 350 in some parts of the county, and even lower inland, well within safe conditions for our county. And in speaking to the local state of emergency, I recommend we continue the local state of emergency for another 7 days as we continue to go through many changes and updates, both at the federal, state, and local level. And that completes my updates. I'm sorry, it feels like I've gotten a little sidetracked here. I'm trying to look at the Zoom meeting and my notes here, but if I can answer any questions, I can certainly do that for you now, or I'll turn it back over to you, Chairperson Benak.
Okay, thanks. Commissioner Whitmore has a question.
Yeah, Jake, I'm listening to these numbers, and we've gone up 4 that have died since yesterday. Sherry sent us a medical examiner's report, shows all of Florida, including our district, which is 12. I serve on the State Medical Examiners Commission, so I'm familiar with this. But you're seeing from the nursing homes that it's the employees that are bringing it in. If you looked at the report, it doesn't show on the report if the person that passed away that seems high from the skilled nursing is an employee that was there or was the client. It's really distressing to me when I see a 50.7% and the average state is 8.9. I'm watching the governor every day, and it sounds really good. And then we're seeing what's going on with Manatee County. And I just don't understand why the governor's not here. I've seen him all over the state, and he is not here with one of the highest incidents of this in the state of Florida. He was in Tampa yesterday. Today he's in Washington. I just sent Bill Galvano a note and said, why isn't our governor here? Why? I talked to Dr. Bensi last night, and maybe you know, Jake. The National Guard's been supposed to come in for 2 weeks now. We still don't have, they don't tell us. They're just going to show when they show. And you gave me a report last week, the same thing, that they were supposed to be coming down. They're still not here. So I think we just need to push it a little bit. And, you know, you're seeing these numbers in Manatee County, and then you're hearing everybody else that's great in Florida. My job is Manatee County, and so all of our jobs is. But with a 15.7%, and I think, Sherry, isn't it right, our goal from the very beginning, or the state's goal is a 13%?
Yes.
Okay. So, you know, we got to have some attention down in Manatee County. And again, I send information to Bill Galvano. So hopefully, you know, something's going to happen. The governor was in Tampa yesterday, and this is kind of the hot spot, one of the hot spots in Florida. So thank you, Jake. This has not been easy. I do want to know, you didn't mention about staff, how your staffing's doing. Anybody's on quarantine? And have you heard of anybody in the sheriff's, how they're doing? And the jail?
I have not heard about the jail. Last time we checked, there was no positives within the jail. I speak to the sheriff, and I've spoken to his staff. He's had, I do believe he still has one positive that might have already dropped off. As far as EMS and fire goes, we did have a firefighter test positive for COVID-19 recently.
All right.
Manatee County EMS continues, our numbers continue to drop as far as those been on quarantine, and I'm sorry I don't have the most up-to-date data for you on that, but that is all right now looking good.
So the 8 are out of the quarantine right now then, the 8 that we've been watching. Okay. I was waiting till now that I could disclose, but last Tuesday I had a COVID test. I've been out for 2 or 3 weeks with a respiratory. I met all the criteria. It's not a fun test, but the results came back Friday negative. But, you know, this is a respiratory virus, and, you know, there's a lot of symptoms that are going around that people need to be aware of. It's just really distressing Manatee County with our numbers. So I don't know what to do. Hopefully we can get some attention and get some attention paid to Manatee County.
And our testing numbers are definitely going to go up as like I talked about, the 700 additional tests. Sherry is going to talk about additional testing through MCR. And then, you know, the state regional drive-through test is going to tremendously assist us, as well as the 700 tests that the IMT team, when they do come in and start testing the rest of our nursing homes, will assist with that as well.
And special thanks to MCR Health. They really stepped it up to the plate. Appreciate it.
Okay, thank you. Commissioner Servia.
Thank you, and thank you, Jake, for the all the data and all the numbers and your very hard work. I have a question about how long it takes from the time that we get a positive test result or we know of a death. How long does it take before that data gets to the numbers that you report? Is there a lag time?
There is a lag time, and we're not sure exactly how much that lag time is. We know that when the lab receives a positive or a negative, they report that back to the patient, obviously, and the patient's doctor. And they're also required to report that to the state. So when it's reported to the state, that's when it goes on to our data rolls. And they should be doing that, you know, within a 24-hour time period. I've heard that has improved greatly.
Okay, and the same for the deaths? Or do you think it's about a 24-hour time frame, or do we have to wait for a death certificate to be issued?
You know, I don't have any data on that, and I will definitely talk to Dr. Vega, who I'm also in contact with, and see what he believes that to be.
Okay, thank you.
Okay, Commissioner Bellamy.
Hey, thanks for everything, Jake, with everything that you're doing. Do we have I mentioned this at the last time I spoke, do we have a number that we're trying to conclude to get to that 1% as far as total testing by the end of this week? Because I hear that some more tests are about to be added. I'm just curious on our total number of tests that we're projecting by the end of the week, because we do know if we're projecting to bring in another 500 to 1,000 more tests. I'm not saying that's the number, but obviously there would definitely be increase in positive tests also. So I'm just curious, where are we going with that total number? How many are we targeting?
I'm not sure. I'm not sure that I understand your question. So we're trying to get to a place where we're testing those who are symptomatic and need tests now. If you look closely, even as soon as yesterday afternoon and then this morning, Hillsborough County changed their testing criteria. So the governor, along with Hillsborough County, started saying anyone who wants a test can now get one. Hillsborough's in a place where they believe they have enough tests to start ramping that up and doing that. We're starting to relax our testing criteria here within Manatee County. So if you call the Florida Department of Health Manatee and start and go through the screening process to make an appointment, you no longer need a prescription from your primary care physician to be seen. As long as you're symptomatic and need to be tested, we're going to do that through the Department of Health to get you into the drive-through. So, go ahead.
Madam Chairman, I guess what I'm saying is last time we had this conversation, we was at 1,200 and we were projecting another 700, and I think we were trying to make our way to that 1%. And I am attempting to say how far away are we away from that 1%. We do know that the testing is about to increase, but how many more tests are we about to increase? Is it 500? Is it 800? How many more can we project? Because if the Department of Health can project our increase in our spiking numbers, obviously they're projecting on that on the estimated or the projected amount of tests that's going to take place. So I'm just looking for that number so we can see where we are.
I can answer that.
Sure, sure.
Yes. This morning on the call, Commissioner Bellamy, Department of Health official, Dr. Bensi, announced that with the tests that we currently have, which is right now the total tests in 3,579 based on what Mr. Sauer just reported from the noon report, that puts us at about 0.85%. If you remember last week, we wanted to get to 1%. The state's moved up to about 1.6% as of today. Our 0.85% does not include the almost 1,000 new test kits that have been brought into the community. Those will be coming in throughout this week and next. And then as Mr. Sauer mentioned, if the state regional drive-through comes through additionally, then our numbers will continue to rise. So initially we wanted to get up to at least 4,200 tests to meet the 1%, but we are going to be a little beyond that. But we wanted to keep pace with the state, and now they've moved up a little bit as well. So everything we add will be above the 1%.
Thank you, ma'am.
Okay. Commissioner Johnson.
Yeah, Jake, I look at these numbers a lot, and it just, obviously we're so far behind the curve, that all these other counties, really got the stuff done, and to sit there and look at us at, 15+%, it seems like the more we test, we still, our numbers are still really high. And, I'm curious, can we drill down at all into those numbers? I know demographically Manatee County has a lot of nursing homes, a lot of mobile home parks, and that seems to maybe where a lot of these hot spots came from. But it would be comforting to me at least to know that, if I look at my zip code, we don't have that many, but, some of the other zip codes that we know do. And, I just think it's, when you talk to the public and you're talking about Manatee County being, over 15%, that scares people when you're looking at what Hillsborough counties and the states in the 8%, we're at almost double, where everyone else is. And are we doing something wrong? Or, is there to me, is there an explanation that maybe we need to try to understand why our numbers are so high? We're, I think, sixth in the state out of, 67 counties, and, and yet, I just don't understand it. It just seems like the more we test, the numbers get worse, rather than better from a percentage-wise. And, and we're sitting here today being asked to potentially, reopen areas and things like that. And I'm like, wow, sure, I'd love to do that. We watched the governor with the president on TV, and, he's getting ready, I think, to, start opening things up. And you know, we have to make a big decision in Manatee County as to whether we're going to go along with that against the numbers that are telling us, no, you still got big problems, Manatee County, with this stuff. And, you know, I'm just really torn, but I just was wondering if, you know, you or, Dr. Bensey or anybody is trying to maybe, again, drill down into those numbers and see why are our numbers so out of whack? Is there some abnormality or abnormality there that has caused us in Manatee County to be such a high number vis-a-vis what's going on in the other parts of the state?
So definitely, I talk very regularly with Dr. Bensey, and you know, we ask the same questions, and most of the answers to that is our long-term care facilities. We've had outbreaks within our long-term care facilities. That's why we've requested the incident management team from the state as well as the National Guard to come in and start testing the rest of these long-term care facilities, so that we can get a better understanding and hold of where these outbreaks are and get them contained. So on the flip side of that, we know that, you know, those are sterile as much as we try to make them environments, and the outside is what's bringing staff from the outside is what's bringing the COVID-19 into those facilities. So we know that a good portion of the population comes in contact with COVID-19 outside of those. And that's why when I talk about testing and then continue to increase our testing, every time I talk to you, increase our testing is so we can get a better understanding and start breaking this down, exactly where this is and where it's coming from. Some interesting things, you know, the demographics, you know, males, we have currently 230, or about 41%, and females are about 329, or about 59%. However, that changes for death. The death rate, as far as males or females within Manatee County, is higher for males. And then we start looking at races. You know, we've had 88 positives for African Americans, which is about 16% of the positives within our county, whereas Manatee County has an African American population of around 9%. So we know that they're a more susceptible group when it comes to COVID-19 as well. So that's the kind of data that Dr. Bensey and her team's looking at every day. We're talking about it every day. And we know that a lot of those positives that we're seeing is coming from our long-term care facilities.
Okay. Well, you know, again, I guess, you know, we need to continue to focus on those facilities and you know, and I've got, you know, several friends that are in those facilities and they're locked down and they can't see their family and it's causing the residents a lot of stress, you know, as well as their loved ones. But on the other hand, if that's where, you know, that's what's driving our numbers up, then maybe we need to, you know, continue to keep that in a quarantine type position, if you will. But unfortunately, I think it's going to cause some of those elderly people to be so stressed out that, you know, they're going to end up expiring from, you know, some other type of issue, you know, and that's kind of sad type of thing. So, you know, I just am worried about our numbers, where they're at compared to other areas. And you know, I keep hoping that maybe we've miscounted something or that there's, you know, some valid explanation as to why our numbers are so high, again, compared to Hillsborough, Sarasota, and, you know, 60 other counties type of thing. So,
yeah, and I agree with you. I agree with you. That is what worries me as well. And when you talk, and when you listen to the governor, and you know, I listen on the state conference calls. The governor has said that although overall Florida is on a downward trend, and that is great news. Florida is not. It's a large state. It's you know, it's each specific region. Unfortunately, we're different even from the region, the Tampa Bay region that we're in. So.
Commissioner Johnson, let me just add I think I sent you all a report on Sunday night, and again, these numbers change every day, but on Sunday evening, there were a total of 508 positive cases, and out of that, 181 were at long-term care facilities. So just from Sunday night's report, 35.6% of those cases were from those particular long-term care facilities. And out of the 42 deaths, 18 of those were in from long-term care facilities, and that was 42.9%. So what you're honing in on is exactly where the hot spot is. And I'm going to mention that, again, when the statewide task force starts to work here in those long-term care facilities, they're projecting about 700 staff and residents put together that they'll be testing again. So we have been isolating those numbers to look at those particular areas because those are going to still be your hot spots. But as Mr. Sauer mentioned, our numbers are still going to go up. It's just going to become more and more important as to where they are, where those are and at what length of time. So you're right, that is the area to be concerned about. We've got some individual data on that we keep tracking every day with the Department of Health reports.
Okay, thank you.
All right, Commissioner Ball? Madam Chair, I'm as probably frustrated as every other commissioner on this call right now. And I think we're going about the way we're looking at the figures perhaps in the wrong way. I mean, it's great, we're sitting back and we're going, we've had 563 positive cases. Okay, well, we know that. But how many of those 563 have been treated and released at this point and are well on the way to recovery or have already recovered? How many are we looking at that are sick today? And out of what Sherry just said, thank you, Sherry, I was going to say that. It seems to me that we know we have a problem in the nursing homes, 2 or 3 especially. So what are we doing at those nursing homes? What plan has the county put together to work on those nursing homes where those problems are? I mean, I appreciate Dr. Bensi being on the call last week. It was very informative. But, what's the plan? What have we done? Are we sitting back going, we don't know what to do? Is the numbers keep going up? So, where's the governor? We need the state here. Or do we have a plan here in the county to handle this situation? That is what I am really concerned about. The state is not the end of all here for us. We're in this thing. We know where the cases are. You guys are keeping track of this. So when you come to us in these meetings, I want to hear a plan. I want to hear what we're doing to curtail this situation. And how many in the nursing homes, where are we today exactly? I mean, I've heard different figures. One day it was 23 fatalities in the long-term care. Now I just heard Sherry say 18. And I know that's what's on the list, Sherry. But I know that list hasn't been corrected since yesterday at 10 o'clock in the morning. So I know those numbers have changed. But, we need, and when we get in these meetings, we need some totally 100% accurate information with a plan for us to talk about to see if we think that's the plan that we need to have. Because the situation today looks like it's kind of twofold to me. We know we have a problem in the nursing home. Unlike Commissioner Wetmore, I'm not in the medical field, but, it's common sense, a lot of this. So what are we doing there at the nursing homes? But then we also have another area, a much larger area in Manatee that isn't experiencing the increases that we're seeing in the long-term care facilities. So is it really fair to be treating the two the same? I mean, we need to be able to make those decisions. I can tell you, Pinellas, they just opened their beaches. State Representative Will Robinson had sent me a text before the meeting. Pinellas just opened their beaches with a 6-foot social distancing. Sarasota's done that. So here we are sitting in the middle, and our rates are higher than everybody else. So we have a problem, and we need to figure out what that problem is and come up with a plan to handle it. I appreciate all the testing that we're doing. I think that's a step in the right direction. but it seems to me in the nursing homes, it's going to take more than just going in and testing. Is it a situation where, I hate to say this, and I don't know how you could do it, but the employees, they have a role to play in this. They're going to work every day, and they're bringing it in to the elderly who are the most susceptible to this virus. So what are we doing? I haven't heard anything as far as the employees in these nursing homes. What are we saying to them? Are we having conversations with them? Fill us in on that, please, because I feel like I don't quite understand the situation there. And it seems to me that we need to, maybe this board can talk about it. Commissioner Whitmore's a nurse. She knows this stuff. So, what's the plan? How can we handle this?
The plan has been in place for...
Stop it at the bit to answer. Go ahead, Jake.
The plan is in place. I want to make a couple things clear here, because the Department of Health Manatee is got every possible resource within our 9 facilities that have an outbreak. We have the state already here in all 9 facilities, and we've been doing assessments on those facilities for the last month. We continue to test and test and test. The National Guard is coming in to bring in a large amount of tests for those 9 facilities, and they are working day and night to try and get that under control. The Department of Health Manatee, as well as ACA, is in charge of those long-term care facilities, and they are doing everything they possibly can to get that under control.
Thank you. And that's kind of what I wanted to point out, that the resources, they are overseen by the Department of Health, which is a state department. We don't have authority over the nursing homes. I get that we want to come in and we want to fix this. It is extremely frustrating. But I think, Jake, isn't the reality, even though a large percentage of our numbers are coming from these assisted living facilities, skilled nursing, whatever the proper term is, that we don't have the highest rate in the state of Florida. That's why other nursing homes areas are getting a lot more attention than we are in Manatee County. Isn't that true? Even though we've got a big issue here, the fact of the matter is, if you look at the list of nursing homes and the numbers, we're not at the top of that list. Is that correct?
That is correct. And in fact, the IMT team that is for our region, Manatee County, as well as Sarasota, they set up shop in Lee County. I know that we were focused on Manatee County, but Lee County is in a worse predicament than we are at the moment. So when we talk about resources, there's only so many resources to go around, but our IMT teams are here within the county, within our 9 facilities that we have outbreaks within, and doing everything they can every day. Our EMS chief, as well as me, the medical society, Dr. Bensi, and medical directors of those long-term care facilities continue to meet on the best modes of treatment, how they get treated within their facility, if they need to be transported to a local hospital, what's our next steps that we're going to do with those. So, just like it took us a while to get here, it's going to take us a while to get out of here as far as managing those long-term care facilities with outbreaks. By no means is Manatee County the first or the top when we talk about long-term care facility outbreaks.
Right, and where we can appeal to the state for more testing resources, we can't bring in the National Guard. That isn't the purview of local government. We don't have that authority. The state has authority. I challenge Commissioner Baugh to tell me what she thinks
I will.
Give me time. In this situation, I'm in a dialogue with you, because I don't know what resources we have. Who are we going to put code enforcement in the nursing homes? What are we talking about? What is your plan? Well, I seriously, because this question has been asked previously, so I'm not sure if we have a new idea of what the resources that we would put to this issue. I would love to hear, because it is frustrating. It's frightening.
Let me just say one thing. The Florida Department of Health, as well as Manatee County government, we are not in charge of those long-term care facilities. It's run through ACA. And ACA has made it very clear that they're in charge. But I can tell you, I talk and see Dr. Bensi's health team frequently, and this is they are working tirelessly in these long-term care facilities.
Right, and that's,
Is it my
I know
turn?
I've talked with Senator Scott about this, talked to others, but I do want to hear Commissioner Ball's ideas, because if there's something that we could be doing, I would love to know what it is.
Is it my turn?
Yep.
All right. Okay, cool. I never said that we were at the top of the list. I mean, thank God we're not at the top of the list. That would be a pretty big embarrassment, don't you think, to Manatee County? But what I do know is that, yes, I know the health department, the state, is the health department run by the state. I know that. But I also know that we're sitting back and we as a county, a local government, the policy committee that we had, okay, there are some things that we can do, such as getting the word out, talking to the employees there. What are they doing when they're going home? What are they doing that is bringing this back? How are they catching it? Are they doing the social distancing? Now, don't tell me you can't have that conversation, because they are citizens of Manatee County that's affecting the entire county. So it is not in my purview to tell the policy committee what they can do or can't do. What I'm saying is that when we have these meetings, I want more accurate figures than what we're getting. I know how many cases we've had total. But what I want to know is how many active cases we're looking at today. How many active cases are in the hospitals today? How are our hospitals doing? I haven't heard any of that yet. So it seems to me that we have a group that is handling this with our Manatee Health Department run by the state. I've heard everybody wants to know why the governor's not here, and I thought it was a great question that Commissioner Whitmore had. But truthfully, the governor's not going to be able to do anything other than come in and say, oh, yeah, you got a problem. He's going to send in other people. I've heard the last 2 or 3 weeks about the National Guard. Are they here or not? Exactly what is taking place at these hot spots that we're having. And by the way, you should be able to look at us and say, you know what? If we got hot spots, where exactly are they? I haven't heard that. I've heard about 2 nursing homes that I would call hot spots, but I'm sure there's probably more than just those 2. I've seen the figures. So how many hot spots do we have in Manatee? And I guess the biggest question that I want to know, or I can come up with a plan, but I'm not the one that should be doing this. What do we need to do to quarantine those areas so that the rest of Manatee is not affected, so we can come up with some decisions? Now, that's from a county commissioner with no medical background, but I do have some common sense. So,
Carol, I just wanted to let Carol know that I asked these questions because I was up next. Everybody else had spoke, so I wanted to have a chance to ask, and I wanted to ask Commissioner Ball. So you will get your chance, but I'm going to go to Sherry because she can explain the reality of what has been discussed with Dr. Bensey, who is unfortunately not here, but these issues have been discussed with Dr. Bensey. So Sherry, we haven't had any discussion. There's been no policy group meeting for 2 weeks now. So go ahead, Sherry.
Right. Couple things, try to answer. One, might help you to feel more comfortable about one of the main things that the IMT teams are doing that are here is they have what's called an infectious control checklist. I sent a copy of that to the board at some point. They go through and they review the various areas in the facility, building access. They go through an extreme checklist, and then they counsel and train the individuals that are either employees and or the residents there on how to better protect themselves. They look at their PPE, their personal protective equipment. They do an assessment. They help them understand how to use it better, how to be more safe. They look at kitchen facilities, laundry, on and on. There's a big checklist for infectious disease control, and that's what they're doing right now. And that's how they help train those areas. As of yesterday, commissioners, and I don't look for this figure every day, but the 3 hospitals did respond, and there were about 60 cases as of yesterday that were in all 3 hospitals. I don't have the breakdown of whether they were using ventilators or they were just positive their first test or they were there showing symptoms. I just know that there were about 60 cases identified with a potential relationship to COVID-19. Hotspots for right now, we're relying on the DOH data, and we watch the zip code areas. Again, as you guys were mentioning, the 34208 zip code has a tremendous number of long care facilities. It has the Manatee Memorial Hospital. It has one of Rural Health's larger, their east facility, and so we attribute a lot of those numbers directly to the location of the various testing sites. 34221, of course, as you know, was another area where two things happened. One was the Convention and Visitor Bureau drive-through testing site originally done by the Department of Health, and also one of the other long-term care facilities in the Palmetto area that was on the higher list. So when you look at those two zip codes as being the highest ones, about 30% of the cases are in 08, 15% are in 21, or 34221, sorry. 9% are in 34207, 8% are in 34203, another 7% in 34205, and the other larger area is 34202 at 5%. So we do see those numbers, and we try to work with those, and I think, as Commissioner Ball was asking us, that gets us closer to where the hot spots are and where some more targeted testing can be, and I think that's where the positive relationship with MCR Health has been, is because they have locations throughout the community and various locations in those zip codes, and so we have encouraged people to be able to get to those locations where tests are available.
And Jake, I want to ask some questions, and I'll turn it over to Carol. Since so this idea that because we're going to have more tests, and we really are going to have more tests, and we're going to have less standard, if you will. You don't have to have a doctor's order. It's entirely possible that our numbers will start, as a percentage of the test, the percentage of positive will start to go down, as opposed to where we've been, where we've had such strict criteria that the only people that can test if they have 3 symptoms, or this algorithm that requires them to meet all these standards. With more testing, less criteria, it's really possible that our percentage of positive tests will go down. Does that make sense?
I'm certainly hopeful that that's going to be the case. However, within our long-term care facilities, we've identified 9 that have some type of outbreak. And the IMT teams from the state are here, along with ACA, and they are managing that. The governor and the Florida Department of Emergency Management have said they're bringing in the National Guard this week to start doing additional tests within those long-term care facilities. So I want to caution you when I say, yes, hopefully they should come down, but we do know that we have additional positives within those long-term care facilities that we still have to flush out.
And one of the major problems in the long-term care facilities is they don't have enough employees. A lot of employees are not going to work anymore. And that's what I've heard. That's what I've heard 2 weeks ago when this question came up about the incident management teams going in, when Dr. Bensi was on the call. We did hear that the fact of the matter is that, yes, a lot of these people that are working in these nursing homes, they were working in more than one nursing home or facility, whatever long-term care facility. Some of them had to be physically stopped from going to work. But the reality is there's a shortage of workers. Isn't that correct? In being able to attend to these folks in these nursing homes, it is a situation. And I'm not sure what the answer is, but when I hear the National Guard is being called out, I hope that will be helpful.
Yeah, that is correct. And our local Department of Health has issued involuntary quarantines to some of those employees that weren't following the guidelines. I spoke to one employee, one of long-term care facilities, and he said, if I have to show them one more time how I wash my hands, I think I'm going to go crazy. But he understands that's the importance, and that's what they do every day, every hour.
Okay. All right. Thank you. Commissioner Whitmore.
Well, Senate President Bill Galvano responded. He's meeting with the governor tomorrow. He will bring this up, and he'll get with the Department of Health. What I wanted to say, and we've got to be real clear. I mean, I'm hearing, in all due respect, we've got to stick with the facts. Manatee County is not going to have a plan to address these assisted skilled nursing. They're not. This is under a state department, which is ACA. They've run nursing homes for as long as I can remember. I serve on the State Elders Affairs Advisory Board. I can't do anything with the elderly anywhere unless ACA approves it. So don't think that little Manatee County can go up and come up with a plan and say, you need to do this and our employees need to do that. It ain't going to happen. It's under the state. I made some notes. As far as the National Guard, you're right. The health department has been, I talked to Dr. Bensi last night. Health department has been in all those facilities, and Jake is absolutely correct in trying to teach them infection control. I know for a fact that there's one facility in Manatee County that has an 80-year-old cleaning the entire facility. Now, when you get paid 10 or 11 bucks an hour, and then you're in such a fixed income in these facilities, Florida is in our district is the lowest reimbursement from Medicare in the United States, and it always has been. So I'm assuming that formula probably pertains to these skilled nursing. So this is what happens, and that's why you see these people going from nursing home to nursing home, working different jobs to get the money. The long-term care, somebody said that Manatee County is like the hot spot for all the skilled nursing. I know there's some medical professionals in the audience, and they'll probably confirm that. There are more skilled nursing, assisted livings, independent livings in Sarasota County, and also you mentioned Charlotte County and Venice. Are you kidding? That's where all they are. I mean, we just happen to have an infection control problem. The health department goes in, they train them, they talk to the administrator who knows nothing about infection control. Like Commissioner Baugh had said, some of us know healthcare and some of us don't. They leave and then they're having to retrain them again. So I'm hoping Senate President Galvano can give us some action because we do need some help. This is not the only issue, though. These are hotbeds from our citizens from outside of Manatee County that brought it in. Now, Dr. Bensi, I think with the kits we got, she has 50 for tracing, correct? Somebody?
60.
So she can, 60? Okay, so the employees that go outside and they've tested positive, they'll be able to trace them, who they've been in contact with, and keep this chain going, which we haven't been able to. So let's just be very clear. We can tell everybody we want to do what we want. This is under ACA. The only people that can help us are the state, and hopefully Senator Galvano can get us something. I don't care. I think the governor coming to Manatee County is a good thing. Maybe some don't. But, I mean, the governor of Florida. But for him to come to Tampa and all the others, and the rates are so low, and then he has to see this hotspot in Manatee County. We're the fourth highest, correct? Are we still the fourth highest?
Yes.
Last week we were. Still the fourth highest.
Yes.
He's been to Miami-Dade and Broward. So has he been to the other one behind us or in front of us? I don't know. So I think it's time that Manatee gets some attention. And Jake, hopefully this message to Galvano will help. And we need to, I mean, yeah, everybody's going to say it's a nursing home. Well, I'm sorry. I care about everybody, not just people that aren't in nursing homes. I'm a health care provider.
All right, Commissioner Serbia?
Thank you. Jake, I have a question about, do you know if we're transferring patients from the hospitals to the nursing homes, or has that been halted?
No, we can't halt that. When we talk about care for residents within long-term care facilities, obviously the best approach is to treat them at the long-term care facility. As they deteriorate or they get other secondary infections going on, or they just simply cannot compensate, we want to get them to hospitals to get further treatment. So we work closely with the medical directors within those long-term care facilities on what is appropriate to try and treat and manage within the facility, and then that's when EMS gets involved when they need to be transferred out because they're deteriorating or just simply not able to get the care that they need within a nursing home, and we transfer them out to local facility hospitals.
Okay, so we're transferring from the nursing home to the hospitals. Are we also transferring patients from the hospitals to the nursing homes? And is that contributing to the increase in numbers?
So once they get, once a known positive long-term care resident goes into a hospital system for treatment or care, before they can be discharged back out to that long-term care facility, they have to have 2 negative tests, COVID-19 tests, before they're able to be discharged back into that long-term care hospital facility. Sorry.
Okay. All right. And I know our discussions have focused on the long-term health facilities, but I just want everyone to remember those are not the only positive cases. And I learned today that there is a patient, I think our first pregnant patient in Manatee County, who is currently on a vent, and they had to deliver her baby. She came in at 35 weeks, pregnant with COVID, and is now on a vent. So it's not just the nursing homes. We don't know enough about this yet. We're still learning how it's transmitted, and I'm very concerned about that.
Thank you, Misty. Commissioner Ball. Yeah, just out of curiosity, I think, again, Commissioner Whitmore hit it right on the nose. We do have an infection control problem. That's an understatement. So in what, going with what Commissioner Servia said, and that goes back to my question, Jake, that I think it would be very helpful to us. I realize there's only so much we can do because the state does have a big responsibility. I get that. I knew that before I ever opened my mouth. But the point is, it is causing an issue for all of Manatee County. So that being said, is there some way that we can get more accurate figures than just a total of who has tested positive for this virus? Who has it today? How many are we dealing with today? And Sherry, thank you for the information on the 60 in the hospitals. That's very helpful. I've not seen that anywhere. I've been looking everywhere to get that information. I hadn't seen it. I've asked it several times. And then the other thing is, for like what Misty Servio was talking about with the woman that was pregnant, you know, out of curiosity, do we have any idea, or has the Department of Health gotten that far yet, where they might know how she, you know, came down with this? I mean, was she, you know, around someone that worked at a long-term care, or, you know, do we have any idea of how it might be that she came down with it? In other words, are we at that point where we're able to kind of get an idea where these people that are coming down with it now, if most of them aren't, or I don't know whether to say most of them are long-term care or they're not. I don't know. I don't feel like I've really been given enough information to be able to say. So, Jake, what is the plan for, you know, looking at this and trying to get it under control as a county? What can we do in that regard?
Test.
Well, I said that too. I mean, yeah, okay, I got that part. But, you know, there's got to be more. I mean, you know, once we get the test, all right, let me ask you this, out of curiosity. The long-term care facilities. I know that there's people in there that do not have the virus. And I'm sure they're all very nervous. I heard from one young man over the weekend. He sent me a beautiful email. I am going to send it so everybody knows, to all of you. You know, his mother, he takes care of his mom at his home, but he works in a long-term care. So, you know, he's trying desperately to make sure that he doesn't bring it to her. So it dawns on me, we have a lot of people in these homes that do not have the virus. What is going on with them to try and make sure? What can we possibly do? I'm sorry, when I say we, I mean all of us that are working on this issue. What can we all do to try and take care of the people that are in these long-term facilities that haven't tested positive? Is there anything in place for them that we're doing? I haven't heard anything on that.
So the IMC teams that are currently here within the county, working within the facilities that we know have positives, or, you know, for better lack of term, an outbreak of positive patients in their long-term care facilities. That's part of the IMT's job, is when they go in, you know, they're looking at the employees and the infectious control procedures. They're cordoning off the known positives from those who aren't, to try and spread that out. Interesting enough, you know, some IMT teams, like in Pinellas and Hillsborough, they've gone so far as to close down long-term care facilities.
I had seen that.
Have outbreaks.
Yeah.
Ours has not done that yet, but you know, I do know that the calls continue and the meetings continue every day of getting this situation in long-term care facilities under control. And that was part of, you know, when we talk about the Florida National Guard coming in to do testing, you know, those two long-term care facilities that took it upon themselves to start testing all of their residents and employees. That was our initial spike for us as well. And the National Guard's coming in to start testing all 9 of those facilities, employees and residents, to figure out, okay, where is it we need to focus better on, and what is it that we need to do with those positives in the long-term care facilities. I know today we've talked a lot about long-term care facilities and positives as far as COVID-19, but the public itself, we continue to need to test and test and test for the public itself, so that we can say, eventually, when we get to that 1%, to that 2%, we can start having a better look at where are these outbreaks at. Do they just contain themselves right now to the long-term care facilities and the public's not? Or, you know, is it a mixture of both? And I can tell you today that some of those positives do come from long-term care facilities, but some of those do not. Some of those are the public that's out here today as well. So I just don't want the public to think, it's contained to the long-term care facilities and I can let my guard down. Please, by no means do that, because we know we have positives, whether they be symptomatic or asymptomatic, within our community as well as the state as well, that we have not continued to flush out.
Thanks, Jay. Okay. Thank you, Jay, because I do see, looking at Florida Health COVID-19.gov, they have a list of all of the skilled nursing facilities and the numbers that they have, the date. So all that data is available. You know, if you want to do a comparison, it's all there so we can see where it is. But I heard from Sherry, and Sherry also sends this out on a daily basis, her afternoon numbers. We usually get that about, there's a 6 p.m. report that we get, and it also says how much is going on in the nursing homes, so that we do know what is the percentage in Manatee County in these nursing homes, because we have a percentage. You said, Sherry, you said 40-some percent, isn't that what you said? And I can't remember what the date was exactly.
35,
what was that?
35%. Well, that was Sunday's number, around 35.6% on Sunday.
Okay. Yeah. I mean, it is hard. There's so many numbers and they change every day to do the statistical analysis, but it's possible. I mean, you know, we can run these percentages so we know. So I agree with you 100%, Jake, when you say it isn't all nursing homes. It just isn't. It is a very big problem that we're dealing with, but it isn't the only issue that we have. So Commissioner Servia and then Commissioner Bellamy, then we're going to go to the public.
Okay, yeah, I have read that there may be an opportunity with smartwatches to track, you know, the people who do test positive, to then go back and look and see who they have been near, if that person had a smartwatch on. Are we looking at that technology?
So the state of Florida itself is not looking at that technology just yet. We approached that question to Florida Department of Emergency Management as well, and they were going to check into it and let us know. Australia is testing that out right now. They're not having much luck. There's as you know, the public is they're very apprehensive about somebody looking at where they've been, and I just don't foresee that's going to help us in the near future at all. You know, the Florida Department of Health has brought in additional epidemiologists. They continue to bring them into Manatee to do that contact tracing that's required. You know, if someone tests positive, where have you been and who have you come in contact with? Interesting to note, when we started this with patient number 1 for the state of Florida, it was not known where he contacted that COVID-19 when we started this some 2 months ago.
Right. There was a story on 60 Minutes last Sunday about a large business who was using that technology for employees. I don't know if anyone saw it, but it was very interesting. And so all of the employees wore a smartwatch. And then when one employee was determined to be positive, and that was just during work hours, then they would see who he interacted with or who he was close to, so they could begin preventive measures to protect the other people. Anyway, just a thought. I know nobody wants to be tracked, but if you have a cell phone, you're already being tracked.
It's definitely interesting, for sure.
Yeah. Thank you.
Yeah, that's absolutely true. That's how they track, that's how we get our traffic data. It isn't personal, but they know where you are and where you've been, but they don't use your name. But that data is being used. Commissioner Bellamy.
All right, I want to ask a question to Jake, and I'll preface this by, obviously, I have a military background, and I don't want to offend anyone in the military or the National Guard, but obviously we were trained, if we get orders, we move immediately, not eventually. Do we have an estimated time of arrival of the National Guard, Jake? Because to me, and I don't want this coming from Manatee County, but it seems as though we keep saying we're waiting on the National Guard, we're waiting on the National Guard, we're waiting on the National Guard. So my concern is there are National Guard members here locally and outside our community that are listening, and we definitely don't want to offend them. We definitely want to hear and receive their support. Do we have an estimated time of arrival from the National Guard? When are we expecting them? Because the last couple of weeks, this have come up, and we're waiting. Our community is hearing this also.
I do.
Do we have an answer to that?
I do. Dr. Bensi just reached out to me. The IMT teams, which is where the National Guard is part of for the specimen collection, and remember I mentioned the infectious disease control assessment list. They're in Region 6. That's our region. Dr. Bensi just let me know they're supposed to be in Manatee County tomorrow.
Okay, thank you, Madam Chair. And one last question, just for community understanding in mind too. What role are we expecting the National Guard to play in flattening the curve? Obviously, we welcome any and all support that we can get, but what role are we anticipating from the National Guard?
So they're coming in to assist the Department of Health with testing. That's what we are waiting on.
Also, they'll put together, I'm sorry, Jake, because I just have this new information. They'll help them put together their own infectious disease control plan for each facility. If they need to, if it's any of the high-level ones, they'll help them set up smaller COVID units within the facilities so they can separate those that are not currently infected from the ones that need to have special care. Those are just a few of the things that they'll be working on tomorrow with those top, I believe 4, right, Jake? I think 4 facilities that are the main ones.
9.
9.
9 facilities that we're looking at.
Thank you.
Okay, that's the last commissioner I had. Sherry, did you have anything before we go to public comment that you wanted to add?
Not related to Jake's update.
Okay. All right, well, I'm going to go ahead and go to citizens' comments. We're all okay. We don't need a break yet, right? Anybody need a break? Let me know when you do. Okay. So we'll go ahead and start with citizen comments. Sherry,
Okay.
if you'd go ahead and call folks up.
Thank you. Those in the audience, the Board of County Commissioners welcomes your comments. Your presentation must be limited to 3 minutes. We do have a few people signed up, and if you wouldn't mind, we have some marks here on the floor that can keep you spaced properly. And just for those of you that are listening, I think you might be able to see our audience is spread out with social distancing here. First, we have Kevin Wright up, and then second, we have Sharon Hillstrom, and third, Sean Roberts. Thank you.
I'll start with the bottom line up front. I'd like our county to follow the lead of surrounding counties and open our beaches and restore and reflect the faith in those who elected you. Manatee citizens, to the maximum extent that the governor's prescribed rules will permit and as rapidly as they will permit. There's nothing in intelligent analysis of data for our county that prevents this from happening to both reasonably protect all aspects of our health and welfare. That goes beyond just COVID-19. I support Project Resurrection Task Force. I know you're familiar with that. It was about 10 prominent business members that have been in contact, and they have put together a plan with our state elected officials, and I'm sure that you have seen it as well. It's a little bit more ambitious than what I think that you'll have a flavor for doing, maybe a little bit more ambitious than what the governor wants to do, but I support that, and I think you should share that, and that should be the basis of some of your conversation. I support the advice that I know each of you have received from state elected officials, and I'm aware of some of that, but I remain astounded that much of this advice has generally been cast aside by you. I support reformation of Florida sunshine laws, but until then, I support that our county commissioners follow the Florida sunshine laws as written. It's a question of your credibility if you're going to absolutely insist and infringe upon our civil liberties, but at the same time not adhere to the written laws of the state. I support the use of all data and all applicable science as decision-making driver in response to COVID-19. But the one thing that is most lacking is statistical analysis. Polls and number of phone calls you get, that's not even data. The data that is provided by public safety is great, but that is all it is. It's data. The one person that has not been involved in this process from day one is an expert on statistical analysis. Thankfully, many states across the nation, as I've observed, are starting to engage and employ statistical analysis. Some of that has been provided to you to involve. You ought to have a statistical analysis expert because a lot of the questions that are coming up that our public safety director cannot answer, and none of you can answer because that's not your area of expertise, could be answered if that was the case. Some of you have been provided statistical analysis and you've rejected it and said that you don't want to have anything to do with it. We, the citizens of Manatee County, will not hold you accountable for the health impact of COVID-19. We will, however, hold you accountable for your response to it. We will hold you accountable for the decision-making process you employ, and in the end, we will judge whether your response was competent, informed, and measured. Was it based on thoughtful analysis of all the facts, data, and inputs, or was it based upon cherry-picking and sharing of only that information which supported your fixed opinions? Thank you.
Thank you. Next is Sharon Hillstrom, and after Sharon is Sean Roberts. Thank you.
Good afternoon, Madam Chair, Commissioners, Ms. Courier, and Mr. Palmer. I'm Sharon Hillstrom, President and CEO of the Bradenton Area Economic Development Corporation. Today, I'm representing the Sarasota Manatee Project Resurrection Task Force. The task force consists of a team of experienced business and medical leaders who have managed through past crises and economic development CEOs who have strong connections with the business and government sectors. You have received a copy of a letter the task force sent to state elected officials recommending a locally driven approach to a safe, slow, and methodical reopening of businesses in Manatee and Sarasota counties. This approach would involve a joint effort of local businesses, chambers of commerce, economic development organizations, and local governments. While all of our task force members acknowledge the vital role of state government in this transition, we also strongly believe the most effective way to rekindle our local economies responsibly and quickly is from a bottom-up, locally driven approach. We believe that our local communities, in consultation with public health experts, are best suited to tailor an appropriate reopening process. The process should help businesses address the health and safety needs, wants, and concerns of customers and employees while respecting the needs, wants, and concerns of people most susceptible to the virus. As you know, many businesses are open now. We just want to give others the option to open as well. Today, we would like your personal support of this locally driven and carefully reasoned approach so we can tell the community that the region's businesses are ready to begin a responsible reopening process. We invite county staff to consult with us on the details as you deem appropriate. Thank you for your time, attention, and thoughtful consideration.
Thank you.
Thank you.
And we have Sean Roberts.
Good afternoon, Commissioners. I am far less prepared. I don't have anything written. All I have is a ball. I'm a very visual person. I actually wanted to come and speak to you guys today about the opportunity to open Manatee County skate parks. I emailed you guys very frustrated, and I am very apologetic about it. I'm a father of two, and I avidly visit our skate parks with my 3-year-old and my 1-year-old son, and my wife, who is subject to filming us all the time and kissing boo-boos. So I want to implore you guys to think about it. If I were to touch all over this volleyball, wipe sweat off of my face, perhaps cough, and I threw it to anyone in this audience, who would catch? You're wild. So not a lot of people would want to catch this volleyball, but I see that there are many recreational activities that are cleared that involve something like this. Whereas when I visit a skate park, the last thing I want to do is touch anything other than my feet to a board. So I just implore you guys to think about it. I think that it's a recreational activity. If we're policing how many kids are coming to the skate park and then kicked out, maybe we can work on social distancing measures being practiced. I don't have a lot of answers. I just want to ask if you guys could think about it, consider it, and I appreciate your time and your service to our county. Thank you.
Thank you.
Thank you.
Is there anyone else in the audience that would like to speak right now? Chairman Benak, I do not see anyone else at this current time for this item.
Okay, I'm going to close public comments, and we're going to take a 5-minute break before we come back and talk about, we have some issues to talk about, board members, and figure out what we're doing, and hopefully get a report kind of where the governor's at. I did not hear anything today, but I might have been out of the loop. I know there was supposed to be a press conference. I kept looking for it. I couldn't find it. And then I heard that perhaps that was being delayed till tomorrow. So, so at this time, we're still under the same order that we've been under. It is in effect till April 30th, so we cannot change things at this time other than the things that we can, which is the beaches and the parks and stuff. So I didn't mean to go on, but we're going to take a break, and we'll be back in 5 minutes, and push your buttons, and I will call on y'all, okay? Thank you.
Ready, Commissioner.
Okay, we're going to reconvene our meeting, and Sherry, I understand you have a presentation.
Yes, I'll just go through it quickly. This, Commissioners, this information is specifically relative to your discussion on reopening strategies, and Seth's going to help me with this. We're going to go to slide 1 and move right into slide 2 to talk about an update to the board for the potential strategies that reflect federal and state guidelines for opening Manatee County. Also, we're going to provide a timeline for potential reopening elements and discussion, update you on COVID-19 testing enhancements, the county COVID-19 operations, follow up with our reopening strategies, and then just briefly remind you that Hurricane Preparedness Month is right around the corner, and hurricane season starts on June 1st. The first slide, Seth, after that, please. This, I just want to remind the board and the community that on our www.mymanatee.org website, we have a special COVID-19 page, and when we talk to you about different documents and things that we follow, these are mostly all posted on that page. This is just a simple screenshot of the main page that keeps you updated. Next slide. Next, as you know, we're eagerly awaiting any changes on behalf of Governor Ron DeSantis and his task force on any changes they might make to current orders. As Chairman Benak mentioned, the two significant orders right now, one is the stay-at-home order, which is scheduled to end on April 30th, this Thursday, and then the majority of the remaining orders that were listed in the governor's orders are tied back to Order 2052 and then 2090 and 91. Those, most of all of those end on May 8th, if not either suspended earlier or extended by the governor. So those are key to a lot of the things that people are talking about, and as commissioners have said, the status. We had some assistance from one of our main librarians, Erica Dow, to put together a quick guide. This is a page of it, and it can also be found attached to your agenda item. And it is really easy to follow through what all the executive orders are and to follow the dates of their expiration. The next slide is a Manatee County resolutions and related COVID emergency documents. And Erica and her team did a similar project for us, and they have the Manatee County related resolutions. And so these are quick guides for you or citizens to look at as to what the orders are. As we move along, we wanted to remind everybody that the testing sites, and you've heard a lot about the testing already, but this right here is a screenshot of what we've been putting out on social media. It's a quick flow chart, and I'd have to say, thanks to Commissioner Baugh, she asked me about a week ago if we could put together something that kind of helped people guide through this, and so we did this, and this has been being posted. It allows the individuals what number to call it MCR services, MCR Health. Also, if they're calling the health department's health line, or in a case of a very large emergency, 911. Also on there, you'll find the various different locations for rural health testing, and we're encouraging everyone to attend any of those, as well as tomorrow's DOH Department of Health drive-through. The next slide is just a quick overview of those testing enhancements. When you asked Commissioner Bellamy how many new tests are out there, the county's been associated with working with both MCR Health and Department of Health to bring in about 1,600 additional tests to our area since last Tuesday's meeting. The breakdown is here. About 1,000 are at the MCR Health sites, and with some assistance from Manatee Community Foundation, who sponsored 200 of those tests for about 1,000 kits that are test kits that are available now, and with the Department of Health, as you've heard, around 600. We await the regional testing site for from the state of Florida, and in earlier discussions, they mentioned that they would be able to do anywhere from 350 to 400 tests a day, and their original proposal was around 14 days of managing those tests. And again, that's regional, meaning anyone from the area or the state can come to that site, not just Manatee, not just Sarasota. The next slide talks about the participation with local hospitals, and I want to call out the local hospitals. We have 3 very exquisite hospitals. They've been struggling and working really hard to stay up with what's been happening in the community and trying to keep us updated on what they need and what their status is. They continue to test patients that present at their hospitals. They also continue to make themselves available in the future based on their association with various urgent cares that they are in charge of for additional testing in the future if that's needed. The Manatee County Medical Society is also on standby to participate in some way community-wide for testing and or other assistance. So we have a great source of collaboration. And just as a mention, in our private health care and urgent cares in the community, Ellington Urgent Care has stood out as doing some new rapid testing for antibodies, and they're doing something on their own. So we wanted to recognize that there are those types of facilities working in the community, as well as there are a couple local efforts with clinical studies, and you may hear about those in the future as those are worked through. The next slide is generally, these are the federal points we've been following, and this guide has come out over the last several months, over the last month and a couple weeks as the phased approach from the federal government. It's a phased additional approach. It's based on up-to-date data and readiness, and it's a proposed phased in. And so we've just provided you with some of the guides from the White House and the President on the core state preparedness. When you look at this next slide, you talk about the core preparedness responsibilities, and this is for testing and contact tracing, and we think we're really doing a good job in the last week of picking up the pace on both the testing, collaborating on testing, and then the contact tracing is something the Department of Health carries on doing with the patients that are testing positive. And for those that might not really know what that means, it's if you have a connection with a positive case, and the Department of Health has special individuals, nurses, epidemiologists, who follow those cases and try to assist individuals with testing if they need it, or with symptoms, reviewing their symptoms. You also have the healthcare system capacity, and I think Mr. Sauer went over some of that too, that we think currently that our healthcare systems are equipped right now to handle the kinds of cases that we currently have, and hope that continues. The next slide under the President's guidelines is the proposed phased approach. And there are 4 areas here, and that's based on up-to-date data, and that is what we are trying to provide to everyone. As mentioned, I do a daily report using the data available, and for those interested, the Department of Health, State of Florida, has a website that is rich with data. The data comes in twice a day, around noon and around 6 p.m. I do a 6 p.m. report to the board, so you have a collection of that data, but any citizen can see that same data. Mitigating risk of resurgence, those are things that we're working on. Then protecting the most vulnerable, and you mentioned the skilled nursing facilities and long-term health with the infectious disease assessment tool. And also then implementing statewide or county and region-wide on a local basis, and we're again working with the governor to outline those. Next, it talks a lot about individuals in the President's guide, and this is another reiteration of what people need to do. Wash your hands with soap and water, or use hand sanitizer. Avoid touching your face, sneezing or coughing into a tissue or inside of your elbow, away from other individuals you're around. If you have a sneeze or a cough, You need to also do that inside a tissue or your elbow. And then various other strong recommendations about how people need to continue to carry on safely. The next slide is also for employers and talking about the employer follow-up and social distancing. And I think we heard a lot of talk about that. You're hearing now about the ad hoc Sarasota Manatee Resurrection Committee, and they have some suggestions. Temperature checks potentially in the future, sanitation, using disinfectant, and then limiting some business travel. These are all common suggestions that people are following now and should also be adopted by businesses as you move forward. So those are main points of the federal guidelines. And again, we're waiting now, the next slide, for the governor's task force recommendations. And I mentioned those two elements of the two main areas, the public health emergency and the safer at home. We've also been, for our own department work, we have 12 departments, and we have been following along with what each department has been doing throughout these particular about the particular COVID-19 times, and we do have a report from a department basis, and we wanted you to know too, there's a state report that comes out every day as well. So we're just providing people with information and knowledge about the different strategies that are going on here. Next, we'd like to talk about the tentative reopening strategies over the next slide. These particular strategies both impact COVID-19 virus itself and our status of the infection. You've already heard much more than you probably want to about that today, and that is what we've been reporting over the last several weeks, and we'll continue to report as part of our obligation and responsibility under our emergency management team. You have heard about the president's plans and changes, and again, we're waiting to hear some more from the governor. We've put together a reopening strategy concept that basically lists weeks. We hope that this becomes a less and less necessity over the next several weeks, but we did want to just update you currently. Under the week of April 27th, you can see this is where we're at today. We're here at this meeting. We have requested that the current local burn ban be eliminated for next week. We're going to talk about beaches in a moment, but this is where we currently stand. We're still teleworking here within the county offices, but our parks and preserves are open, and we're tracking key indicators. Phase one of a planning process for reopening includes following the suspension orders from the governor's office, looking at public beach opening with parking restrictions, which potentially could happen beginning May 4th if the board wishes. This would be for your public beach areas, preparing other county facilities for social distancing, using the guidelines for public spaces, basically in our exterior or outdoor areas, parks, preserves, various programs that are happening at the parks. And then we have also been letting you know that we've been modeling budget scenarios, and we are going to be ready to talk to you about the revenue projection impacts to several of our main accounts. And this is of great importance, I think, to the board as we start to work through the budget process. And then again, we continue to do the tracing of key indicators for our county health. In phase two, under reopening, which we identify that as the week of May 11th, and again, we want the board to understand and the public to know that yes, we are planning as an administration. We plan daily. We talk as a group daily on numerous different occasions with various different aspects of our organization. We collect data. We do analyze the data, and on the week of May 11th, we had planned a virtual budget work session to talk about the current revenues and the potential impacts. Also, continuing the phased implementation of social distancing, and then providing any technical assistance to develop protocols for businesses that need to reopen. Manatee County's strictly just following the governor's orders. Once those change, we want to be able to help technical assistance to businesses and make sure that they know they're supported by their county government and that we can help them if they are not sure if they can be in compliance with any new CDC guidelines or any guidelines that might be directives from the governor. And of course, continuing to track key health indicators. So just moving along, I won't go over each one of these next weeks, but we did put them into weeks in case this board needs to continue to meet on a weekly basis to address any of these issues. And it basically continues with helping technically for protocols for business opening and continuing to phase in public facility openings and public places. Seth, you can move on then to the last one of these three slides, which is by month. And we are certainly hoping that by the time we get to the first part of June that this is a memory that's behind us and that we're tracking historically going forward. And all we have to worry about is something we're very skilled at, and that's preparing for hurricane season. Also, as you know, that usually starts our budget process for your overall budget. And we will be coming back to you with a potential modified budget schedule. In July, we're going to be asking you later in an agenda item today to modify your calendar possibly for land use meetings so we can do some catch up in June and July. And then again, more of the same as we move along into August. We hope those particular months will not continue as they're listed. Real quick, want to turn it over if Jake is still available and still on the line. Mr. Sauer, are you there to talk about hurricane season quickly?
Yes, ma'am.
Thank you.
Okay, next slide, please. Okay, so it's almost May, and as you know, hurricane season starts in about 34 days on June 1st, my dad's birthday, so I never forget it. But that's kind of our entire mission here, and what we're very used to when we talk about emergency management is the hurricane season. Something we're not a stranger to. So wanted to just give you a brief update on hurricane season and how that plays in part with COVID-19. And I'll speak directly to the residents real quickly. Now's the time to know your home and business, and what level of evacuation it currently resides in, and when was it built? Because as we talk about plans with evacuations and sheltering, we also talk about when your home was built. Typically after 1996, it's up to the latest building standards that we will sometimes or could possibly relay to residents to shelter in place. So know when your home was built and the wind load. So and always residents can still text opt into our Manatee Ready informational system to continue to get updates as well that we push out frequently. Next slide, please. Okay. So about evacuations and COVID-19, in daily conference calls with Florida Department of Emergency Management and Director of Emergency Management, Jared Moskowitz, he has placed a high priority into what does it look like with sheltering in our counties when a hurricane is approaching, and also dealing with COVID-19. We do know that we are going to make some modifications to our evacuation plans, our shelters, and our special needs population, but we're not there yet. We're still in close contact with the Florida Department of Emergency Management. The director has set out a goal to get the work group in charge of this moving and set out quick recommendations for the counties so that when we look at a possible hurricane approaching earlier in the summer rather than later if we get one early in the summer rather than later when we mostly get many of our hurricanes, that's going to look, could possibly look starkly different than what it does on our normal hurricane season year after year. So, when we talk about evacuations, we typically evacuate in zones, and those are by flooding. So, you know, when we are going to make modifications to what evacuates and doesn't, you know, we're looking at that. Our public shelters, we're looking at colleges to assist with the local school system as well. And then what do you do with those COVID-19 possible patients and sheltering with other residents as well? That's something we do not want to have happen. So, you know, we anticipate moving some of our shelters around if needed to house specific COVID-19 patients, screening and enhancing our screening with questions, medical histories, and thermal imaging or thermometer taking daily, as well as entrances and exits when you come into those shelters. So we're compiling that list now in preparation for the workshops that we have going on with the state level and local as far as our sheltering and evacuation should a hurricane approach sooner rather than later in the summer. Next slide, please. Then this is just a quick brief overview of our Emergency Operations Center. So as you all know, during a hurricane, we bring a whole host of emergency support functions, and those staff both internally within Manatee County and externally that help support our Emergency Operations Center. And I know it's hard to read onto the right, but that's a updated list of all of our emergency support functions, who's in charge of those, and the functions that they do. And we bring quite a few of people, both internal and external, into the building to help assist in the Emergency Operations Center as those storms approach. So luckily, we've had a great screening process here at the Public Safety Center and have that down pat. We'll continue to do that. But the need for us to actually get into the same building and increase very close communications as a hurricane approaches and how we operate after that hurricane still exists, and we believe that we can safely do that. So some FEMA training has been closed. The online FEMA training still continues. Our emergency management team still continues to participate in those trainings. A quick update to our disaster fund. As of April 28, 2020, there's $6.4 million in that disaster fund. And we know that if a hurricane does approach and cause damage to our county, we can no longer rely or wait on FEMA and monies from FEMA to assist us in getting the county back up and running and the essential functions participated. So that disaster fund really assists us greatly when we talk about post-disaster recovery and what we need immediately to be able to do that. And speaking of post-disaster redevelopment plan, Jerry is here. He has an office within our building, and he just gave his first update, and that is still ongoing. It's still on track and planned to march out as we initially planned, and we'll be bringing, once that is complete, we'll be bringing an update to you on our post-disaster redevelopment plan as well.
So, okay, thank you, Jake. We just wanted to make sure to throw that in to keep sure everybody rolling towards the hurricane season startup. But so for me, board members, I think I've provided you with some overview of how we're looking at the reopening process. And as a summary, just want to follow up and any questions we can answer or a discussion that you'd like to have, please go right ahead.
Okay, thank you. I know we got a couple of commissioners with their hands up. Commissioner Servia first.
Thank you. Sherry, can you tell me, or Jake, if citizens need an appointment in order to take a test?
Yes, ma'am. They do need an appointment, and then those are available. You can call and schedule those appointments with the Florida Department of Health, Manatee, today. Right now, it is open.
Okay. And just for the public, Jake, could you please tell everyone that phone number? I've had one person tell me that they've been unable to reach anyone to schedule a test.
We have two numbers, and again, I just happen to have them handy here, Jake. We have the workflow, if, commissioners, if you need to, reference anybody to this quick guide. If they're having symptoms, they can either contact the Manatee Health Line at 941-242-6649. That's with the health department. If you're having symptoms and you need to get tested quickly, remember right now, MCR Health has 6 locations available, and you can contact them at 776-4000. Also, though, urging everybody, if your symptoms are very strong and you're very concerned about your health, you may want to contact 911, and Jake's staff is still doing screening at that number.
Okay, that is wonderful. And I also have a question about libraries. I've had a number of citizens ask me if there are plans to reopen the libraries. Do we have any information on what the view is of the committee?
Well, right now, the county administrative staff has discussed all of the different functions of the departments. For libraries, we have a very robust virtual system going on right now, which is available to citizens, and they can even do their library card sign up online. We have not slated in any opening date for that type of facility as of yet. When you see that timeline by weeks, we would be determining when it might be most appropriate to place that back in the weeks. We certainly need to do some physical changes to those facilities based on whatever social distancing requirements end up coming out of the recommendations. We're watching again the governor. Is he going to have additional stipulations that we want to adhere to at our public facilities? So right now we're still encouraging everyone to use the online library, virtual libraries until we can come back with some future information.
Thank you.
All right, Commissioner Whitmore.
First of all, the Sean Roberts, I don't know if he's still there, the gentleman with the ball. After you got done speaking, you've caused an internet rage. I guess your Facebook page is pretty packed. My daughter was very impressed on how respectful that you were and what you asked, and that is a good point. He actually sent all of us emails, and some of us probably did respond. I told him, with the governor's direction now, social distancing, it isn't going to be able to happen. So, Sherry, when we get to the parks part, if we could talk about that. Also, we're giving 60 test kits to Dr. Bensi for tracing. Is that enough when we saw that we have 1,000 tests going out? Because if somebody tests positive, then we got to follow that person and test the other people. So I don't know. I know we gave her 60 out of the others that came, but if somebody could just make sure, or our data will be for naught, kind of like what Steve said earlier. All 3 hospitals have furloughed employees, and it's because they're driven by elective procedures. So that's gone down to hardly nil right now, and they're giving bonuses to try to get people, some people to work, and some have let people off with pay, and others are doing something with also following unemployment so things get going. So our biggest employers in Manatee County have also had furloughs with their staff. I don't know if MCR is still there. I know they were going to come. Dr. Colgate, Sherry was going to say something, or Patrick. I don't know if they'd already left. So if you could just let us know about that. Parking, the beaches, that's a big one, all 3 mayors. I haven't talked to Dan, actually, but I have talked to the other 2. I know for a fact on the islands, all 3 cities have a few, or 2 of the cities had no side street parking. So if you park on somebody's right-of-way in their front yard, you will get a ticket. And it's been like that for 2 or 3 weeks. So when we decide what we're going to do at the beaches, if we say we're going to close the beaches and no parking like Sarasota is doing, there's no place for them to park. I know. So Bradenton Beach, I talked to John Chappie today, maybe, or yesterday, and they have a few, but the other 2 cities have none. I know people that live out here that have gotten $50 tickets for parking in front of somebody's house. I know you've presented a schedule, and then you all can answer this because I'm done after this. You all presented a schedule regarding meetings, And today or yesterday, we had our May 7th land use meeting canceled. I talked to Sherry and I said, why? I mean, we can use the convention center like we had talked before. And she said they could do it if you guys decide we could add a May 7th land use meeting on a Thursday. It just got canceled today or yesterday. So yeah, I talked to Sherry earlier. It was canceled today on our calendar, but we still could do it because we are going to be so far behind. So those are just my comments. And Sherry, if you want to tackle them, or Jake.
I can start. We do have another item on the agenda to talk specifically about your schedule and schedule modifications. There's a slight change from being able to do the May 7th meeting. We would not have enough time to advertise. We just learned legally for the May 7th meeting, but I would offer that the May 12th work session date that we had in place for the budget could be scheduled as a land use meeting if that's something the board wishes, and we can talk about that when we get to that next item. Because there's also a few other dates in June and July we wanted to bring up for potential consideration. On the beaches and potentially opening the beaches on May the 4th, what we were looking at were parking restrictions, not eliminating all of the parking, reducing the amount of parking available and asking for people to limit the amount of time that they are there. So if a person would normally try to come to the beach and stay all day, we would have a limited time parking so that more individuals could be able to passively enjoy the beach. On the contract tracing for kits for the health department, I'd have to follow back up with Dr. Bensi. I know they have 600 tests right now because they did get the additional 300. So we'll find out from her what she feels is needed for the contact tracing.
And also,
She actually,
I'm sorry. And then when you're done, the other questions.
the specimen collection kits actually come directly from the state to her, and she tells us what she is comfortable with using for drive-throughs and holding back for contact tracing. So in my next phone call with her, I'll just confirm, but she's the one that sets what's used for testing through drive-throughs and what she holds back for her own contact tracing.
Okay, my only last two was the skate park situations and MCR services, if they're still there.
Madam Chairman, Commissioners, MCR Services, Dr. Colgate is still here. Mr. Carnegie was here, and he chose not to speak. The skate park, was that the other question? That is on our list as a review for county facilities for proper use once we find out what the actual guidelines are going to be. We don't know if there are going to be new guidelines given out by the state or by the CDC, and if there were, we'd be able to react pretty quickly. But right now, we don't have skate parks or even any of the other, like the fitness center or any of those other types of facilities that are usually groups of people slated to open in this next week's round.
Okay, thank you. I don't know if Colgate, I don't know if you wanted to hear, because we've talked about MCR all day, but they haven't said anything, or maybe they don't want to.
We've closed public comment, so I didn't have them on the agenda. Commissioner Ball.
Yes, Jake, thank you for the update on the hurricane, getting prepared for hurricane season. You made a comment that it hadn't even occurred to me about possibly having to evacuate COVID patients and general, I don't even want to think about it. Good luck. Thank you for handling that. Madam Administrator, I thought that your report was very good. I appreciate the conversation I had with you earlier on some of this. And I think in looking at Pinellas, who is scheduled to open their beaches on Monday, and I think they're going to have particular times. I'm not really sure. But it would seem to me that if Pinellas is opening their beaches and Sarasota has, as you know, opened theirs, restrictive, but still, I think they're just open in the morning and I think again in the afternoon, I believe, but their parking lots are closed. I think it almost necessitates us having a conversation on that today, because I would think that the citizens in Manatee, I don't know if you guys are getting a lot of emails or phone calls, but I am. Also, social media is just pounding. People want to be able to walk on the beach. I know that Sarasota, has restricted being able to go and just sit in your beach chair and relax on the beach or go in the water or anything like that. You can walk, etc., but that's about it. So that is a good thing, and it is good for the citizens. So I was hoping perhaps, Commissioners, that we could have a conversation on opening our beaches Monday morning as well. I do think the one thing that I would like to see that I didn't see in my sister city, Sarasota, I think we should open at least part of the parking lot, at some capacity, 50%, whatever. People need a place to be able to park. So I don't know. I don't live near the beaches, but I'm just hearing it from a lot of citizens. And I do feel that, I got to tell you, this commissioner would love to be able to go to the beach and walk on the beach. I think I've missed that almost more than anything else that's been taking place. So I just thought I would mention that. Also, I would like to hear what the other commissioners think about the task force, the Sarasota Manatee Task Force that Sharon Hillstrom told us about. I did get a phone call from Matt Walsh last week where they were working on it. So I really appreciate the citizens coming forward, the business owners, and trying to come up with a plan to help us on that. And they realize, too, that we really can't do much until we hear from the governor tomorrow. So I'd love to have a conversation on the beaches, however, to see where you're all at. Commissioner Whitmore, I'm a little scared. It seems like every time we have one of these meetings, I find myself agreeing with you more and more. Never done that before, so I don't know. But, I do think the skate parks, I understand where the gentleman's coming from, and I saw his email as well. And, we do need to let people get some fresh air and exercise, and our children, need that. So I don't know. I don't know how we could work it out. That's not my bailiwick, as some people say, but I do think that we need to start looking at easing things up a little bit for our citizens so they can at least feel like they're really living. Under the pretense, of course, that they continue with the social distancing and no more than 10 people in a group. Obviously, that goes without saying. And I'd even like to have a conversation perhaps about masks, but you didn't hear me just say that. So, Commissioners, I'm hoping we can have a conversation on the beaches. Thank you. Okay, Commissioner Bellamy.
A couple things, Commissioner Barr. That may be answered prayer about you and Commissioner Whitmore. That's just an inside chuckle with all with all of us, and that's great. We need that right there. I have a question, maybe to Jake and Sherry, back to the testing, and I have a couple things, Madam Chair, if you don't mind. Back to the testing, it's almost to say that per patient, you're going to allow 2 tests. Because if an individual tests positive, right, that individual will have to take another test in order for them to be released back to work. And is it 2 more tests, or do they have to have 2 negative tests? So now that may be a total of 3 tests if an individual actually tests positive one time. So here I am looking at the number of testing kits that we're bringing in, and looking at the number of positive cases that we have. I'm wondering, this is to you, Jake, with that data, with the numbers, are we really, when we're saying we're bringing in 500 testing kits, but we know we have a certain amount of positive tests that we're projecting, how's that impacting those testing kits? It almost seems like that we're coming up on 3 testing kits for one person that tests positive. Are we looking at that, and how is that impacting our total testing kits?
So, I have to double check with Dr. Bensie's office, I still believe that they are doing the 2 negatives. And that is for residents of long-term care facilities being discharged from a hospital setting back to the long-term care facility. So I would definitely will reach out to Dr. Bensie's office to make sure that, one, that is still a requirement. I do believe it is for them to be discharged, but I'll definitely reach back out to her to check on that. And
so that's my point.
The test that we get for the testing sites, when we talk about the additional 600 plus an additional 500 more from Florida Department of Emergency Management, that is for us to use to start testing the public. The hospitals have their own testing supply chain that they're using to test individuals within the hospital system.
So I guess where I was going, if subject matter A tests positive, and that's one test, and then after subject matter A has gone through whatever necessary steps in order for them to be tested again, that's test number 2, right? And then in order for them to say, okay, you're no longer symptomatic, and we're going to test you this final time, that's test number 3. Am I correct to say that the tests that we're bringing in for the supplies, we're utilizing those for those tests also?
No, so they would be tested on their hospital supply chain. So those 2 negatives, and I recall a conversation of eliminating that third, the 2 negatives before being discharged out of the hospital. So I will definitely follow up with Dr. Bensie to double check on that. But the testing within the hospital system, they have their own supply chain of tests. So they're not using those ones that are coming from the Florida Department of Emergency Management.
Okay, and Madam Chair, are we discussing the beaches right now? Okay, so can I comment on that? Okay, is this a jurisdictional thing? And this question is maybe to Mickey or the county administrator, because I know you have Mayor Shappy, Murphy, and I think her name is Tisley for Holmes Beach. Am I saying that correctly? What role do they play as far as saying that we can open back up the beaches, or what collaboration do we need to take place so all of us could be on the same page? Because we're taking the hit that we need to open the beaches, right? Do we have that jurisdiction to just say, okay, open beaches? I'm not saying we're going to do that to the community or the constituents, but what jurisdiction as county commissioners do we have? Because just listening to some of the constituents and to the emails, you do not have anywhere to park out there. So if we are going to say open, or someone's going to suggest that, and we do open them, obviously on the next phase, if we're going to open, someone's going to have to know where they're going to be able to park at, and things like that, and what restrictions. But I'm more concerned being on the same page with Chappie, Murphy, and Tisley. And ma'am, if I'm not saying your name correctly, I apologize, ma'am. That's not who I am. But what jurisdiction do we have, Mr. Palmer and the Madam Administrator?
I'll take the first stab at that. As to those beaches that are part and parcel of your county parks system, and so that would be specifically Coquina Beach and what is known as Manatee Beach, you are in control of those. Let me give a simple example. The building that Sherry and I are sitting in right now is owned and operated by Manatee County government. It happens to be situated within the municipal boundaries of the city of Bradenton. Nevertheless, you as the owner of this real estate control the comings and goings from this building. So in my estimation, it is no different when we're talking about a county-owned beach facility. You control the comings and goings since you own and operate the facility. Now, that's not to say that when it comes to reopening these facilities, we wouldn't want to coordinate with the beach municipalities. Of course we would.
Commissioner Bellamy, I've spoken individually, one-on-one with each one of those individuals to brief them on concepts that the county administration was going to bring forward to the board, and talk with them about any impacts it might have. As Mr. Palmer said, we're talking about the county public beaches, right now. We are located within some of those areas, but they also have some of their own areas that they manage. They are all three, and as well, I spoke with Tom Harmer, who also has some beach as well in Manatee County, and indicated that we feel that May 4th, Monday morning, would be a good opportunity for us to reengage opening the public beach area, and that we would have a parking, we have some parking restrictions, not all parking closed, not all parking opened, that we are in control of. I mean, what Mr. Palmer's also mentioning, some cities have their own parking in their municipality that is used for beach parking. They have the ability to handle those how they would like to handle them. But we think we can have a reduced parking availability to help ease back into the beach access, and then possibly limiting the amount of time you can park in those areas by, let's say, you can park 2 or 3 hours, and we would have the ability to use our code enforcement and coordinate with our municipality, and coordinate with our municipalities, police departments to help enforce some of that while people still can practice social distancing on the beach. So they are aware, and we've taken those different concepts into consideration.
What I would not want, Madam Administrator, is for us to come up with a way to open the beaches and then individuals that's traveling to the beaches not have anywhere to park, because once we say that it's going to take place, obviously the beaches are going to fill up. What we don't want is to put a strain on our constituents if they don't have a place to park, and therefore parking tickets start to go to increase. I think we need to approach that strategically and look at that so we don't put our community members in a difficult situation. But I'll stand down and listen to the rest of the commissioners. I'm sure Commissioner Johnson, who I think is on the beaches, will have some input on that. But I just think we need to make sure that the other entities are involved in this decision making. So thank you for that insight.
Thank you. Commissioner Trace.
Yes, I think excellent. I think it's time to start releasing some. I think the governor will. I like this plan. So I'm going to make a motion that we take the plan that the administrator gave us today with a 2-hour parking, have the parking open for 2 hours, because we don't want people loitering. They're supposed to come, exercise, walk around. They're not supposed to be sunbathing. They're not supposed to be taking their coolers down there. So I would say let's take the advice of the administrator, and that's my motion for 2-hour parking.
Do I have a second? I will second it for discussion. Thank you. Commissioner Johnson.
Thank you, Priscilla. I see where Sarasota, I guess I'll start this off by saying that we all know Sarasota is smarter and richer than all of us up here in Manatee County.
Yeah.
And so it beguiles me as to how they're going to open their beaches, but not their parking. So it's like, how do you do that? It's like, okay, so again, I guess if you own a nice place on Siesta Key or, someplace like that, you can go walk the beach and not have to worry about it type of thing. But if you're living in downtown Sarasota, you can't drive out to Siesta Key and park. So, it comes back to, it's like a meaningless gesture, in my opinion. But again, they're smarter and richer than we are, so that they must have had some other great theory behind, well, let's open the beaches, but not allow anybody to park there, because I still don't see how you get there, unless you're going to, get airdropped in by a drone or something. I mean, as far as, our beaches, are concerned, the city mayors have all, I think have pretty much said they really don't want them open, yet we've gotten, tons of email from constituents. And I, right down to the governor who said, people should have the right to go walk on the beach. Fresh air is good, gets you out of the house. We've all been kind of cooped up here the last, whatever it's been. I've lost track of it. I think my Alzheimer's is kicking in. I mean, but, it's just like, yeah, I'd like to go out to the beach and, and yet people are not always very responsible. You know, again, I mean, I got invited out, you know, to a beach party Sunday night, and I looked at the guest list, and I said, well, there's 14 people here. You know, this is not what we're supposed to be doing. You know, you're supposed to keep it to 10, ideally maybe 2 or 3. But, you know, and then I see, you know, we got that nice email from the clerk of the court who'd been out at Robinson Preserve, and she, you know, quickly acknowledged, well, nobody's social distancing out here. You know, everyone's running around. And the way we, you know, again, from what I've read, you know, the real key in trying to solve or slow down this virus is social distancing. But there's just a lot of irresponsible people out there, unfortunately, that end up, you know, ruining it for those people that are trying to, you know, abide by it and get through the thing. And it's, you know, it's very disappointing to me, you know. And so, you know, as far as opening the beaches and putting a 2-hour time limit on it, I then sit there and go, God, how are we going to enforce that? You know, and who's going to enforce it? The sheriff's department, you know, maybe Sheriff Wells needs to weigh in, and as well as, you know, I got some emails from Mayor Chaffee while we've been on this conversation. He's saying, well, I can send, you know, our ATV people out there to try to help on the social distancing. But, you know, and I'm not saying I'm not in favor of it. I'm just saying it's a very, you know, it's a tough question. You know, it's like if everybody would be responsible for a change, you know, and do what they're supposed to do, then I think it's a great idea to try to open them and, you know, and let people go get some fresh air. But, you know, at this point, you know, I'm open to hear from, you know, the other commissioners, and I just, you know, but I'd like to know how we're ever going to enforce, you know, people not, you know, I mean, unless we're going to send the whole sheriff's department out there, you know, to break up parties, because people just do that. And we see that, you know, the same thing. We opened up the boat ramps, and, you know, I went by the 59th Street boat ramp the other day. Man, 4:30, you know, it's party hardy. You know, everybody's there. They're coming in. They got their beer. They're, you know, they've had a good day out on the water, out at Passage Key or wherever. And, you know, it's like, hey, things haven't changed. And then I come back and I look at the statistics that Jake gives us as to, you know, this growing number of positive tests in the county. I go, well, no wonder there is. You know, we do this stuff and these people just ignore what the rules are. And we don't have the ability, we have the ability to enforce it. We just don't have the manpower to enforce it. We don't, you know, and you know, it's just it's a no-win situation at this point, in my opinion. So, like I said, that's my thoughts. You know, I'm glad to hear from anybody else as to whether I'm crazy, but, you know, I'm just concerned as how we would, you know, implement this whole thing, you know, and it goes whether it's the beaches or, you know, the skateboard parks. God knows I hear from all the, you know, tennis players at GT Bray and everywhere, and the pools, you know, at Bray or out at John Marble that aren't open. You know, people want to get back out, and you're like, well, if you were responsible and, you know, this and that, then maybe we could figure out how to reopen some of these facilities for those people that want that. But I don't know. I'm a little frustrated, as you can tell, on this whole thing. So anyway, those are my thoughts, you know. Thank you.
Yeah, Commissioner Whitmore.
Steve, thank you. I just got a couple questions. Bayfront Park, it's not a beach, but it is. It's a park where we go to the beach on the bay. That wasn't mentioned. So and I know that's considered a park, but it's mainly used for the beach. 2 hours at a time, I guess the motion said. Does that, and from what I heard Sherry say, it was people would come for 2 hours at a time, they would leave, and then somebody else would come. So you're going to have somebody monitor it, which I think is going to be a major cluster. I don't know. But you're going to have code enforcement, and are they going to be able to issue citations? We only got, 10 or 12, 14 code enforcement officers for 640 square miles in this county, or 700. So we're going to have all their time being spent on the islands? Because, you know, I don't know how that's going to work. I do think that we do have to have a plan. I said this last week, to open, and we do need to have a plan for the beaches. But just remember, look at Passage Key. It's a federal bird sanctuary. and there was like 70 boats on it. And Steve is right. They were partying hard, and really, they're not even supposed to touch the sandbar. It's like a $500 fine. And living out here, I see the boat ramps. They're totally packed. I've heard complaints, Steve, about 29th Street boat ramp, and you may want to get code enforcement because I'm hearing every night at 5 o'clock they're having a party, like you said, a party hardy there. So you're probably getting the same complaints. If we do open, the beaches are, I know I talked to Sherry earlier, we're not going to have the concessions open, but what about the bathrooms? Are we going to not allow coolers, chairs, and umbrellas? So those are the things that we need to talk about because I know for a fact that all the mayors are listening. So what is can you be a little more specific on what your idea is for this motion and exactly what was in it, Sherry?
Yes, to be able to open the beach areas, the public beach areas on Monday, May 4th. I came up with a time of around 10 a.m. Yes, our code enforcement can assist with parking, and we have a parking problem no matter what happens. When we're open all the time, I don't know what everybody's getting all excited about on the parking. People come out to the beach and they can't park out on the beach. They can't even go to the beach. It's a very popular place, and so I know it's a problem.
But that's because
we're talking about looking at a limited amount of parking spaces so that the overwhelming response won't be all at once, and it can be a manageable amount.
Okay, in the cities, here's the issue, and I'm okay with starting it, but I know these people are going to go out to the island and see that the parking lot's full with the allotted number you say, and they're going to start driving all around looking for a parking spot. And like Reggie said earlier, people are going to get ticked off. I mean, I know we need to do it. Just be prepared. The mayors are listening. They're going to make a fortune out of these parking tickets. Again, my friend that lives here for 60 years got a $50 parking ticket the other day, going to dinner at his neighbor's house. So it's going to happen. So we just need to be clear, and so the citizens know, because they'll go, well, there's signs all over, no parking on side streets on all the cities, Anna Maria and Holmes Beach, but they're going to drive right past it and try to find a parking spot.
Well, those particular cities have created their own parking limitations now, as you're saying, especially in Holmes Beach. They have their own parking limitations in place that they're policing right now. It's my impression that those wouldn't change unless they want them to change. That would be up to them.
Anna Maria has a real strict one also. I don't think Bradenton Beach does because they don't allow street parking. So they only have a street parking spot.
Right. And Mayor Chappie and I spoke. He has a little bit of, he has a couple officers down just here recently from an incident, and he asked for some assistance. And I did also speak to the sheriff. I spoke to the sheriff separately this morning about, just as we would make sure that we would talk to everyone. There's no perfect solution, but he also had indicated, of course, they would work with us. But, I think that the inevitable is coming. The beaches are going to open sometime soon within the month, I would assume. They're going to, as you're indicating, they're opening around us. A manageable plan to attempt to see how we can ask the citizens to help us ease into that, I think is what we're talking about right now.
And your projected times that you'll close the public beaches every day, and are the bathrooms going to be open, or they'll be going in the weeds? They will. I live out here.
Well, as you indicated before, right now we would not open the concessions, and that's mainly because restaurants, bars, nightclubs, those are still, any restaurants still managed under the governor's orders through May the 8th. Restrooms, we manage the restrooms right now, so I'm assuming if we are opening beaches up that we would be allowing for the restrooms to be open for those persons participating.
And what time are you closing the beach? I know it used to be like 10 o'clock at night, or Betsy would know better than I do, but at midnight they used to do the gates. So what time are we closing them?
I did not have a proposed time. I was leaving something for you guys to mull over. I'm just kidding. first we want to see if you feel comfortable that we're moving in the right direction, and we can come up with some times that are workable. As I said, code enforcement is definitely going to be assisting us. Mr. Barnott's here in the audience, and he and I have talked about the tremendous amount of work they did for us when we first had to close them down, and helping all of the cities as well. And so we think it's something that our citizens, again, will be so excited about being able to participate there that they will follow the guidelines. We will have posted signs. And we're thinking that we're going to be forced to do that soon, no matter what, based on the other surrounding counties and the governor's orders.
And don't forget, Cortez Beach is considered a public beach, Steve, I think. So remember, we got that. That's not just Coquina, it's also Cortez Beach. Somebody brought that to my attention, I forgot. 3 piers. Bradenton Beach.
Those are included, right, Sherry? Any of
Yes,
the
ma'am.
beach area that's owned by the
Now
company.
they are.
Yes.
And we would have the bathrooms open, maybe a sign on them saying, no more than 2 people in the bathroom, or whatever the stalls are, so you don't get a crowd there at a time, so that it would allow for that. And the beaches, Carol, I don't hang out at the beach after the sun goes down typically, so I don't really know what time the beach closes.
Midnight. They close at midnight. The gates go down.
I'm usually there until midnight, but not a whole lot to do after the sun goes down, so appreciate that. But I just wanted to, the issue with Sarasota, and you guys watch the evening news like I do, people are very angry that they have the beach open and nowhere to park. Right. And I don't blame them, and if you live out on Siesta Key, my daughter lives out there, people are cruising the streets looking for parking. They are, so that it is a problem, but we have to have limits. I like the idea of the limits myself. I think it is enforceable. We have parking limits everywhere. You have parking limits in downtown areas. So I think we're doing it for the right reasons. We're starting slow. That's why I'm supportive of this. Okay, Commissioner Servia.
Yeah, thank you. And Commissioner Johnson, to your point, there are some people who are irresponsible, or maybe they just don't care. I don't understand why they wouldn't care about this virus, because today, if you saw the news, we hit 1 million positive cases in the country. And it's killing just a terrible amount of people. A scary amount of people are dying from this. So it is very, very, very important that everyone follow the rules. Having said that, I really like the idea of slowly opening the beaches too. I think that we need to, as Ms. Hillstrom said, slowly and responsibly begin opening the county, because we've got to do that. When it comes to the beaches, Priscilla, I'd like to ask you to amend your motion that we don't allow any games or sports to take place on the beach during this time. I think it is going to be an enforcement problem. Well, it's going to take a lot of staff, put it that way, but we can do it. I think it's a good approach to opening the beaches very slowly, and we can see how this works.
Okay. Next up, I have Commissioner Baugh, and we'll come back to Commissioner Trace after Commissioner Bellamy.
Yeah, I like what I've been hearing. Thank you for all of you sharing your thoughts on this topic. And it is kind of scary because we don't know how people are going to react, but I like to give the benefit of the doubt. And I think that the citizens have been through a lot. If we have it at a 2-hour maximum, as Commissioner Trace said, that kind of holds down a lot of issues, I think. No coolers, no umbrellas. I got to tell you, I think someone should be able to sit on the beach, and Madam Administrator, I would hope that when you're looking at the hours that, we need to let people see the sunset. And I'm asking for that because I got to tell you, I'm going to be one of the first ones there probably on Monday. It's been killing me not be able to go to the beach to see the sunset. And you mentioned, Commissioner Johnson, you mentioned Sarasota. Ironically, I can tell you that I've heard from Christian Ziegler from Sarasota. He is watching this meeting. He is anxious as well. He realizes, the situation with the parking lot. So, it's a regional thing. Sarasota and Manatee are connected at the hip, and that's just the way it is. And Madam Administrator, do you know anything about the beach at Longboat Key? I believe that beach has been open the whole time. Is that correct? Do you know?
It actually, when I spoke with the city manager there, the town manager there, they have instituted certain guidelines on their own, and their residents are able. A lot of the private area, obviously, just like Anna Maria has a lot of private area, but they are managing their beach in some controlled parking and with residents being able to use it.
Yeah, see, that's great. You know what? We've got some great citizens. Not all of them are party hardy. Some of us are getting too old for that type of thing. So I want to give the benefit to the residents. They know how important it is, and they realize that, we're all in this together, and we've got to open the county up together. And I think it's time. So thank you for all of the things that have been said. It's been a very good conversation. Thank you. Commissioner Bellamy.
Yes, I just received a message of a photo with the Grim Reaper sitting on the beach, and and talking about we're considering opening up the beaches too early. This is to our constituents. We have a responsibility. You, as a member of Manatee County, have a responsibility to make sure if this is done, we emphasize on social distancing and taking the necessary precautions. We do feel the nudge to open the beach, and I like to watch the sunset myself. To be honest with you, but I do not want this to come back around and we have parking issues. Individuals are coming too close in contact, going in and out of the restrooms, and next thing you know, we have another issue that's connected to the beaches being open. Mind you, in some of the initial cases from down south, a lot of the individuals that travel to enjoy the beach down in the Miami area were taking COVID-19 back to different states because of them on the beach and them partying and things like that. So we need to make sure we have those precautions and that out in front of us. Because we still have a responsibility to make sure we're emphasizing public safety as leaders. I will raise my hand and say, I think we need to look at it, but the restrictions are going to be in key. But here's the other thing about that. We already have a strained code enforcement department that, in my opinion, that's very, very overworked. They have a lot of different things that's going on, and here is another issue that we're about to put on them. And so I just want us to be mindful. I want us to be mindful of that. With the 2-hour limit, I agree, because that's looking at making sure you're emphasizing on getting your recreation as far as your exercise, your running, your jogging, and obviously your vitamin D for the day. But more importantly, after those 2 hours, code enforcement is going to be challenged because we know some of our community members are going to say, are not going to do make the necessary right decision. I'm just concerned with the impact that is going to be on code enforcement, and I don't want individuals to start visiting the beach, and next thing you know, our numbers continue to rise because of sport playing or whatever they're doing on the beach, and next thing you know, we have some more positive tests. So I think we just need to be mindful of that, Madam Chair.
Thank you. Commissioner Trace.
Yes, I have no problem adding only solo activities because people need to recreate out there, but, running, swimming, as long as they're doing it by themselves. So, Misty, I hope that kind of covers. I understand what you're trying to say. No team sports allowed or just solo. However, that's good. As far as parking goes, I quit going to the beach probably 15, 20 years ago because I couldn't park then. And I know when I want to see the sunset, I usually go to Emerson Point, at least I did before the virus, and they close that place down at dusk. And let me tell you something, that park ranger comes and tells you we're closing the gate and you better get in your car and go, because he's closing the gate and I don't know what you do if you get stuck in there. So I would say whatever, I know we're on, so I would say something like 9 o'clock. I think the sun goes down, and as the summer goes, I do not think we need to keep this thing open till midnight. Or we can say dusk, which basically as the sun stays up longer, then the guys can go on the beach. I don't know what if we have something and take their ATVs and say the beach is closing in 5 minutes once the sun has gone down, and you can whatever. I have no problem adding to the motion no umbrellas or coolers. We want the people to 9 o'clock to walk, shell, swim, and move on. So I have no problem with no umbrellas or coolers.
So you have modified your motion to say a closure.
Actually, I said the motion was to be whatever it was, the recommendation. That may be in the recommendation, the no umbrellas or coolers.
Sherry, could you clarify what the recommendation is so we know how the motion needs to be modified?
Yes, it actually was not part of the original recommendation, and based on some discussions with the various cities, here was the reason why. It's another thing to manage beyond the parking lot, to be out on the beach and manage that. Limiting the amount of time the person might be able to be there to 2 or 3 hours was felt to be still a strain, as you're saying, something that we have to manage, but for then adding on that extra requirement of what they have on the beach was seeming like it was a little bit more and might take a little bit more manpower. I did receive some update that the beach right now is at 10 p.m. closure, but I think 9 p.m. is an option as well.
Right. If the only amendment is to add a 9 o'clock closure, the seconder agrees with the amendment.
I have no problem with the 9 o'clock closure, and also just because, yes, at least from FWC, which has nothing to do with the motion, the passage key, you are allowed to be on it except during nesting season, and I do not know when nesting season is.
Okay. All right. So the motion is, I think, clear. That the recommendation is based on Sherry's recommendation with the addition of a 9 o'clock closure of the beaches. And we've clarified what beaches. Okay. Anything else, Commissioner Trace?
No, unless you want me to call the question.
I don't. Commissioner, let me get through.
Right. No.
You can do what you want. Commissioner Johnson, though, is on the board next.
That's where I was going. I'd like to call the question at this point.
Okay, we have a motion to call the question that has been seconded by Commissioner Trace because she said she would call it. So we have a motion to call the question, seconded by Commissioner Johnson, seconded by Commissioner Trace. If you would raise your hands, all in favor of calling the question, please raise your hand. All right, well, motion passes 5-2, I guess. 5. Everybody who voted for it, did you get it? Did you get it, Vicki? Everybody who voted for it?
I believe Commissioner Servia did not vote for it.
Right, and I didn't vote for it yet either, so
Correct.
I won't. But, okay. All righty. Well, the question has been called. And all those in favor of the motion, please raise your hands. So this is the motion to open the beach.
Okay.
To
so
have the recommended motion by Sherry.
Bellamy, Johnson. I'm sorry, I need to call out each one. I apologize.
I'm call them by. All right, I'll call people. I'll call you by name. Commissioner Trace, how do you vote?
I vote aye, but do you need to call public comment first?
Oh, you're right. Thank you. Gosh, forgot about that. Is there anyone in the public that would like to address this motion?
Seeing no one here in the audience, Madam Chairman.
Seeing no one come forward, I'm going to close public comments. Thank you, Commissioner Trace. All right, Commissioner Trace, how do you vote?
Aye.
Commissioner Johnson, how do you vote?
Aye.
Commissioner Baugh, how do you vote?
Aye.
Commissioner Bellamy, how do you vote?
I'm muted. Aye. I was muted.
Okay, you're on. Commissioner Servia, how do you vote?
I vote aye.
Commissioner Whitmore, how do you vote?
Aye.
Commissioner Benak votes aye. Motion passes unanimously. Good work, guys. Okay, making some progress. All right, I'm going to go ahead and just ask some questions because I didn't get my question answered. So this is in regards to opening up, where we have this group. I'm sorry, I can't remember the name. The group, what are they called, Commissioner Baugh?
The
group that is sent us the letter.
Manatee Task Force. Resurrection
Okay.
Task Force.
Resurrection Task Force. First of all, I love it. I love that people are taking the initiative. We all know that this is going to be a very, very difficult question. I am still not sure where the governor's going. I know that he is going to open up something, but I don't know how. I'm kind of with Kevin Wright on this. I think we need a statistician. I mean, I look at the requirements that are in the President's Opening America, a downward trajectory of documented cases for a 14-day period. I don't think we've met that yet, but I don't know, because then it says, or a downward trajectory of positive cases as a percentage of total tests. Have we met that? I don't know.
Not yet.
So as much as I am supportive of it, and then their statistics that they had were percentage of population case numbers combined in the Sarasota Manatee, and then they talked about a rolling 3-day average. I don't have a good handle on that as well. But I think it's really, I hope that they get the attention from the governor. I know they've sent their letter. I think there's been an opportunity for public comment. The governor has asked for it. So I'm open-minded. I agree that we need to open up. I think a lot of businesses should be opening up and doing social distancing. But I'm not ready to take a position on this till I hear from people that have a better handle on the statistics. And that's how I feel. I want to be upfront with that, because they have asked us to personally support this. I'm supportive of opening up, doing it baby steps. I really like what the governor said about baby steps. I even think his comment on God's waiting room, that's true. We have a lot of nursing homes. Those people are being affected. So I didn't see any problem with that. But I just wanted to say that out loud, that I'm not ready to jump the gun, if you will, without hearing from the governor, his task force, what their plan is. So that's my thought on that. Commissioner Servia, you're up next.
Thank you. And I just have a question on what we just voted on. Is the time limit 2 hours or 3 hours to be parked? It is 2 hours. Okay. And I know we didn't talk about this, but I'd like to know if we have been thinking about what the penalty will be if you're parked there longer than 2 hours. Is it a $10 ticket, or is it a $50 ticket, or is there no ticket? I don't know. And I would like for our staff to keep a close eye on the games like volleyball and football and things like that, which could spread the virus. I have a big concern about that. I didn't want to vote against the motion because it was excluded from the motion. Let's see how it goes, but that's something that we really need to watch.
Yes, thank you, Commissioner Servia. We will definitely give that some consideration when we plan the effort tomorrow morning with the department directors.
Thank you.
Thank you. Commissioner Whitmore?
Just real quick, Priscilla, Charlie Hunsaker thought that what you did about Passage Key, that you, it was only during nesting season, and then he sent Sherry and I an email back that he was mistaken, it had changed. So I would like to ask staff to research that. Charlie just said, and I'm looking for it because I told him it was okay. But if we could find that, and I know that's not our jurisdiction, but we need to let FWC know, because that's where they were partying hard, and that's protecting our wildlife. That's a national bird sanctuary. The task force letter, I got that, and Matt called all of us. He said he called all the county commissioners in both counties personally. And I mean, I read it. I've had to read it 3 times. I mean, I agree with what they're saying. And And they need a decision personally from each commissioner if you're going to support it by tomorrow, because you're going to send it up tomorrow. So I'm leaning to, I'm going to read it again. It doesn't, it doesn't bother me right now. When I read it before this meeting started again, I thought, well, I can live with that. But, and I respect your opinion, Betsy, if you don't, but, we got to get somewhere sometime. We're starting opening the beaches, and now they're trying to help with the businesses, so I get it. And so I'll probably be supporting it, and I'll send it to them. But again, the passage key thing, we'll have Charlie double check and give us the answer so somebody can monitor that. And let's just hope everybody complies and don't disappoint us like they did when we opened the boat ramps. There was parking spots, Steve, for 57 at Kingfish, and there was 154 trailers there. There was only parking for 51. So, and I get it, but, people aren't taking this seriously. I'm sorry. I just don't think that a lot of people in this community have taken this seriously until somebody personally hits you. Remember, Gwen Brown died a little over a week ago. So, and she died from this. No fault of her own.
Commissioner Whitmore, it is year-round. Charlie Hunsicker did review for passage key, and he did a follow-up and checked on it, and it is, it's a year-round restriction, so we needed to correct that, not just seasonal nesting.
We need to let the state know at FWC. I know they don't have enough help, but we do need to, they're going from Jewfish, they're partying out there at Passage, and they shouldn't be, so. Okay, thanks.
All right, and I just want to clarify, if I said that I didn't support them, I do. It's depending on statistics, though. I need a clarification on the statistics, because they had statistics in their letter, and we have statistics. Like I said, the president had statistics that, I'm willing to defer to the governor at this point. I think he's going to do the right thing. We're going to see how it affects us, but we are certainly not all the same in the state of Florida. That's
and Matt said if you call him in that letter or the email before the letter, if you had questions or concerns, maybe he could put something in there and massage it a little bit too.
All right, Commissioner Ball.
This is great conversation. Am I unmuted? Okay. Great conversation. I love kind of where we're going. I think it's very, very good. It's very helpful. By the way, Commissioner Whitmore, I called Charlie about the trailers there at that boat ramp that you were referring to a week or two ago, and he tells me that's not uncommon, that's pretty normal during season. So I don't know. But let's talk about the statistics for a moment. I'm glad you brought that up, Madam Chair, because that's where I've been all day. It's nice to know how many we have total, but that doesn't really help me in getting a good picture of Manatee County today. So that's why I'm asking, and I'm bringing it up now again, that we need to change some of the figures that we're getting. We need more accurate information for us to really know what's going on. We've had all these cases, positive cases, but how many don't have it anymore? How many have been released from the hospital? Where we are today, that's what I think we need to look at and make our decisions on. And I think it's a whole different ballgame when you look at it that way, because we do have hot spots, and I do know that it's in Manatee County, so we can help in some regard with that. The people that I've been talking to seem to feel that we do have some alternatives that we can look at, and I know I've had a great conversation with the county administrator on that as well. And I am concerned, as everyone else is, about us going up. Where are we? I know that Dr. Bensi said it's mostly, in our long-term care facilities. So, I think we do need more statistics. So I'm glad to hear that. And I don't know if this is the right time to bring it up, but what was said earlier about land use meetings, I would love to have one in May. I think we're just getting further and further behind the longer we wait. I don't see any problem in us being at the convention center 6 feet apart. Everybody bring their mask and we're good. So I think that's a good idea. I want to thank you for the beaches. I think that's a move in the right direction because we're going to have to open the county. We can't stay closed. We've been closed for almost 30 days. We're going to have a whole lot more issues than this virus if we continue on and not get this county back open. It's called mental health. And it's also called people having to pay their mortgages and pay their health insurance and feed their families. So it's a big issue. And I can tell you in talking with the task force, the Sarasota Manatee Task, the best I can go as far as naming them, but I think it is a good start for us to look at. Not saying maybe everything in it's perfect, not saying that at all, but it's a good place for us to start in a discussion. And that's where we need to be. We need to be able to have something to look at, to discuss. So, you know, I can tell you I'm not saying that because, as some people have said, you're just saying that because you want to get back open in your business. You know what? I'm fine right now. My business doesn't have to open tomorrow. So it's not because of me. It's because of so many other citizens that we have that need to get back to work, restaurants that need to open, do their 6-foot distancing. If it does, it start increasing the numbers, we're going to see it all over the state, and we're going to have to take action. So, you know, thank you for today so far. I think it's been great. Thank you. Thank you. Commissioner Bellamy?
Right. Just a comment or two about the task force. I was looking at listening to something yesterday, and they were talking about the where domestic violence is going up, child abuse is going up, and we know if we do not look at this strategically, obviously crime is going to take and go up, which is where my concern is as far as in those three areas. I like the approach from the Project Resurrection Task Force. I'm with you. Right, and I'm looking at it. I have not spoken. I did not receive a phone call. I received the email, and I would want to talk to Matt or one of us. Please, sir, let's hold that dialogue. And I said this yesterday. Whatever we do, it needs to have a strategy, and that's what I think that this task force is attempting to bring forward. I don't think it's going, whatever they do, it's not going to take and say, commissioners, you have to open. I think they're going to do some work behind the scenes and come up with that data that we're looking for, Commissioner Burnett and Commissioner Barr, so they can use that data to influence us as well as the governor and those people that are making those decisions. And if I'm wrong, I'm sure when I speak to Matt, Mr. Walsh, he'll inform me that in the angle that they're looking at. But the strategic approach, like I said last night in a conversation, the same way we closed it, I think the reverse is the way we need to strategically looking at reopening it. And it was not steps of decisions were made quick, but they were made with information and they were data driven. And I think that's the level of tone that I'm going to question Mr. Walsh and the task force. But our citizens are speaking to us, and they're also trying to support a need that our community has. I was hit with a question yesterday that I don't have an answer to an individual that is not working and can't, pay some of their bills. Well, where am I going to get my money from? I don't have an answer to that, and I'm concerned about that, and I don't want any one to go to where anxiety picks up, depression steps in. Next thing you know, domestic violence numbers are being charted differently, and child abuse numbers. All those things that are out there right now. So I applaud Mr. Walsh and the group. I want to hear more, and I want to talk to them and have that dialogue and see what they're going to do, Madam Chair, as far as what type of data do they plan on bringing to support this. Remember, everyone in our community, this message, our curve is still going up. We're still moving up within our data. And I'm wondering is with this Project Resurrection Task Force, is there going to be something out there to help those numbers go down? I want to take and make sure that we look at the economy, and all of us are concerned about that. And I talked to one of my great friends yesterday, well over an hour, about the idea of opening up the economy. I understand it, and I do understand we need it, but we also need our curve to go downward. And from what I understand, we are supposed to have 14 consecutive days. Consecutive days. And I'm not necessarily sure we are there yet. Now, if the Project Resurrection Task Force has some strategies on how we get there, so we can say this is the direction that we're going to go, I am excited about the conversation that Matt and I are going to have tomorrow. But the bottom line from all of us, in my opinion, I think, is public safety, and to take those numbers and continue them going downward. And right now we're going up. So I'm excited about their efforts. We need more of this in our community, where they're offering unity for all of us to come together and find a way to tackle this. I'm excited about that, but I would really caution, and as we move forward, to say, hey, our numbers need to be downward before we do anything. That's just me, Madam Chair.
Thank you. Commissioner Trace.
Yes. Are we moving on, or are we still on this?
We can move on. We have two other items that we have to discuss.
I was actually going to make a motion that we have a May 12th land use meeting in the Bradenton Area Convention Center, starting normal times unless the administrator can't handle it, but May 12th.
All right, we have a motion. Do I have a second? I'm going to say Commissioner Baugh had her hand up first for that second. Sherry.
May I add some additional detail for you?
Sure.
Based on your request to potentially hold a land use meeting on May 12th, also on June 23rd with an overflow date of June 24th, also on July 22nd with an overflow date of July 24th, and August 20th at 1:30. Using the social distancing guidelines, in person and at a location where social distancing can be provided.
So are you okay with that motion change?
Oh, I'm fine with all those dates. I mean, sure.
And
Yes.
Commissioner Baugh, you're fine with that as well? And I think we just jumped to that item on our agenda. Is that what we just did?
We just jumped to that item. It's item number 3.
All right. You got to remember, I started work this morning at 6, so.
Yeah, I know. You're trying to
I'm
get
ready.
out of here. I get it.
Yeah.
I see John at the podium. Can we advertise for May 12th at this point? I know we're running up against advertising dates. I don't know if we can do that at this point. So I'm looking to John.
Yes, ma'am, we can. We've already prepared the advertisement, and we're prepared to send it off this evening, based on the board's decision.
To have the items that were, I don't know, they were continued. I can't remember. I guess we did no date certain, but
They were continued from May 7th. The May 7th, I would assume, would come.
The items that you'll hear on May the 12th were originally scheduled to be heard in March. They were continued to April, and now April till May 12th.
okay. So you have time to advertise, and they're all going to be advertised.
Yes, we do. Now, we have put out on our website that the May 7th meeting was going to be continued, but we'll correct that along with the advertising to the paper. 3 of the items on the agenda for that day are county initiated. One of them's already had a hearing. It's just the second required hearing, so it should be a relatively easy agenda that day.
All right. And right now, Sherry, we have a work session on May 12th?
We're offering to reschedule the work session to another date so that you have the ability to have your meeting land use meeting makeup on May the 12th.
Okay. And we've heard we can advertise. All right. We have a motion and a second to amend the calendar, add those days if needed, right? If needed. And at some point, we're going to figure that out, right? Because some of us do have maybe some plans, not sure yet what the plans are going to be, but
Madam Chair.
at some point, we're going to nail these dates down, what we need. How far in advance, John, before we can nail down what, because we're not going to have a meeting on the 22nd and the 24th if we don't need it.
right?
Well,
Don?
we would like to go ahead and schedule those meetings if possible. Your staff in the office has confirmed that those dates are available on each commissioner's calendar.
This would, Commissioners, this would still allow the week of June 29th through July 3rd, the week of July 6th through the 10th, and the week of July 13th through the 17th as no new scheduled items. They would still be eligible for your recess period, and you would not have to resume until July 22nd, which would also allow 2 days in that following week.
Okay. Commissioner Serbia?
No, I can wait until after we take this vote.
All right. Commissioner Whitmore?
This vote.
What?
After this vote.
Okay, Commissioner
You
Bob?
kind of moved the agenda forward, so.
I know, well, that was the motion, and then Sherry did it. She added everything, so we did. Move it along. Commissioner Bob, do you have a question on this motion?
Yes, thank you, Madam Chair. I would just like to insert at this point, since John Barnott is at the podium, that, some care needs to be taken to the agenda when we start doing these land use meetings to not overwhelm us with more than we can get done in a day. So I would just bring that up now, because I've seen some that were just, the agendas were way too long for a meeting for one day. So I would just make that, comment in moving forward. Thank you.
Yeah, you never know. Mr. Survey, Commissioner Whitmore. All right, so everybody's done with your comments on the motion. Can I call for the vote? All right, all those no. Commissioner Trace, how do you vote? No, unmute, please.
Okay. Aye.
Aye. Commissioner Johnson? Commissioner Johnson?
Aye.
Commissioner Baugh?
Aye.
Commissioner Bellamy?
Aye.
Commissioner Serbia?
Aye.
Commissioner Whitmore?
Aye.
Chair votes aye, motion passes. All right, that took care of the last item on the agenda that updated our, I should have called for public comment. Anyone in the public that wanted to comment on this updated schedule for meetings? All right, seeing no one come forward, I'll close public comment, motion and vote stands. All right, back to the letter. Sherry, you want to go ahead and just introduce this quickly?
Yes, and I can clarify this. We felt that, Commissioners, this item, and let me get back to it as well, having some problems with my computer. This item was brought forward to us. We are watching this. This has to do with the additional elements of the CARES Act that provide the assistance to state and local governments. A unit of local government is eligible to receive direct payment, including the counties, municipalities, townships, village, parish, boroughs, or the unit of general government below the state level with a population that exceeds 500,000. What we were hoping to have today, since the ability for the board to meet has been, difficult to get to, is that we would have some sort of authorization from the board to allow the chairman, if needed, to draft a letter in support of to modifying the population level to 400,000 and above to be eligible for any federal assistance. Since we put this on the agenda, we have had some follow-up with our federal legislative liaison and also talked with both Senator Rubio's office as well as Buchanan. We did add Vern Buchanan's letter that he sent up to Speaker Pelosi and Mitch McConnell, and so we would like to monitor this and not necessarily have any formal letter today, but have the ability that we can prepare and share a letter with the chairman and the commissioners if there is action to be taken here.
Okay, I thought this was really important. I know I've talked to Kevin DeLallo about it. Before I knew this was even on our agenda, I spoke with Senator Scott's aide. I spoke with Sally at Vern Buchanan's office. I spoke with Bill Galvano. I mean, this is really important. We're being left out of this act because of a slight difference in population. So I'm not sure why we wouldn't want to write a letter of support at this time. I guess I'm missing.
Right, one other clarification, Madam Chairman, is that Bill Galvano's office has clarified for us that it's possible that there's some additional funds that are under the governor's ability to distribute after the communities that are 500,000 and above now have received their funding. And so we'd like to be able to either write a letter to, have you write a letter to the governor, or to, of course, support this measure, or both, because again, we're just not sure which direction this is going at this particular time and what the allowable expenditures would be and what the guidelines for use might be. We're monitoring it, but knowing that you guys are meeting on a weekly basis, we wanted to be ready.
On this? Commissioner Servia?
No, I don't have anything.
Okay. Commissioner Whitmore?
To make a comment on something else.
Okay.
You moved ahead on the other thing again.
Well, it's on the agenda, so.
So was this.
Well, I am on the agenda item, our number 2. That's what we're discussing right now, this letter on the CARES Act. So everyone is okay with the wait and see. I'm personally, I wanted to move forward because I think this is super important, and I saw Vern Buchanan had filed it, so I don't know why we wouldn't be supportive of it, but guess I won't step down to make the motion. So I will ask Commissioner Johnson is first, then Commissioner Baugh.
Yeah, I'll go ahead and make a motion that we draft this letter. I think it's the more we can do to, get our name out in front of these people on a constant basis. There's no downside on this to me at all. So I make a motion that we authorize, the letter be drafted and sent to the federal legislation.
All right. Do I have a second? I see Commissioner Trace waving 2 fingers. So Commissioner Trace has seconded this motion. All right. I'm going to go ahead and Commissioner Baugh, you want to make a comment?
I just agree. I think we should send the letter. Congressman Buchanan actually called me today, so I think it's a move in the right direction to do that. That's it.
Yeah, and Kevin DeLallo has asked me for it. So again, I'm not sure I'm understanding why we would hesitate. Sherry, go ahead.
I just wondered if you'd like to also consider adding that you send a letter to the governor's office as well, just in case there is funds that are left over at the governor's office. We would, and that would allow you to have both. We could draft a letter as well to them for you to sign.
Okay, I will ask the motioner, Commissioner Johnson, are you okay with amending your motion to add a letter to the governor?
I think that's a great idea. I will amend my motion to send a letter to the governor as well.
And the seconder agrees with that. Commissioner Trace is giving me a thumbs up, so the seconder agrees with that. All right. Any other comment from commissioners? Commissioner Whitmore, your hand is still up?
Else, you just took me off. Somebody did. Okay, I'm back on. It's about something else.
Okay. All right. Is there anyone in the public that would like to address the motion on the floor? Okay, seeing no one come forward, I'll close public comment. Commissioner Trace, how do you vote?
Aye.
Commissioner Johnson?
Aye.
Commissioner Baugh?
Aye.
Commissioner Bellamy?
Aye.
Commissioner Servia?
Aye.
Commissioner Whitmore?
Aye.
Commissioner Benak votes aye. Motion passes unanimously. All right, that is the end of our agenda, so we're going to go to
Madam Chairman, there is one more item on your agenda under the county attorney's office.
Oh, I'm sorry. I forgot all about that. I'm sorry. Mickey, go ahead.
Thank you, Madam
Go
Chair.
ahead and open that item for us, please.
Thank you. Per our discussion at your last emergency meeting, I pointed out that your rules of procedure as presently constituted require the physical presence of at least 4 commissioners here in chambers in order to obtain a quorum. And we know, of course, that the governor's order relative to local government body meetings is soon to expire. And so I suggested that you might want to amend your procedural rules to allow for a quorum to be obtained either by the physical presence or electronic presence of a majority of commissioners. And then there was a second provision, and so the bottom line is that we're changing, we are modifying one sentence to allow commissioners to appear either electronically or in person and to obtain a quorum either way. And then there was a second sentence that limited the number of commissioners appearing electronically to no more than 2, and so we have removed that sentence from the procedures. So it's the modification of one sentence and the removal of a second sentence. And then I would simply like the motion to include my ability to work with the clerk in correcting 3 Scrivener's errors that I have identified. On page 1, first line of text, the word should be statutes, not statues. On page 3, the next to last line of text, 9:00 a.m. should contain a colon, not a semicolon. And finally, on page 14, second line of text, the word should be on, not one. And so I'd like the motion to include my ability to work with the clerk to correct those Scrivener's errors. Otherwise, there are no other modifications to your procedures. As we have traditionally done in the past, you are readopting the entire set of procedures, as a whole. And this avoids piecemeal modifications to your procedures where you have to look at the main document and then look at an amendment and then look at another amendment. And so this keeps things clean, and this is consistent with what we've what we've always done in the past, which is to have you readopt your meeting procedures as a whole as opposed to piecemeal.
Okay. All right. Commissioner Whitmore.
Keep me on the board. I'm still waiting.
Okay. Commissioner Servia?
I'll make the motion to approve as staff has recommended.
Okay. Do I have a second? Commissioner Baugh, I saw raise her hand first for a second. Any comments from anyone? No, on this issue? All right. I'll open up for public comment. Seeing no one come forward, I'm going to close public comment. Go ahead and call the vote. Commissioner Trace?
Aye.
Mr. Johnson?
The Zoom thing down pat now, boy.
Yes.
Commissioner Baugh?
Yes.
Commissioner Bellamy?
Yes.
Commissioner Servia?
Aye.
Commissioner Whitmore?
Aye.
Chair votes aye, motion passes. Okay, thank you. I guess
And
what you guys
by the
wanna
way,
do is-
my office will take care of creating a sufficient number of hard copies of this document such that the next time that commissioners do make it here to chambers, you will have the fresh new copy in front of you here for the chair and vice chair, and we'll have 3 or 4 copies here for viewing by the public, just as we have done in the past. So my office will take care of making the requisite number of copies.
Okay. All right, we're going to go to, I guess, what is going to be commissioner comments at this time. I thought about something, Sherry, and I want to make sure that what we voted, what we're proposing to do to have the meeting in person at the convention center, that assumes that we're not going to be in violation of a governor's order. We don't know for sure what's going to happen, so I just want to make that clear. Because it could be very well more than 10 people in the room, right? I mean, we're going to do everything that we can to make sure it's socially distanced. But,
Yes.
I mean, I don't know what's going to happen, so, right?
Yes, Commissioner, Madam Chairman, Commissioners, we have put together an arrangement for the Center Hall that establishes the social distancing practice for both the board and for members of the audience. But as you indicated, if for some reason it exceeds a limit, we'll have to address it at that time. You're right.
Okay, all right. Commissioner Commissioner Whitmore is up first, and then Commissioner Servia. Go ahead, Commissioner Whitmore.
I got 2 things I've been asked, and I wanted you guys to answer them after I'm done. One of the TV channels, 10, asked Is it, to be clear, are citizens allowed to bring umbrellas, chairs, coolers, etc.? I know no alcohol, and I assume yes, but you can let me know on that. And also, Mayor Chaffee asked me to read something, and this was about the vote on the beaches. I don't know how you're going to be able to enforce this. Bradenton Beach Police Department can't do it. I can tell you that at the boat ramps, the monitor people are already being challenged, I'm told. And now you're going to have a code enforcement officer or a lifeguard tell someone on the beach that your time is up and you need to leave. You're going to be putting our people in danger, your staff. You're going to be putting your staff people in danger. Maybe it's just best just to open it up or keep it closed. When I say open it up, I mean open up the parking lots as well as opening up the beaches as well. And he said the state just put no parking signs on the right-of-way is at the, as you approach the bridges and across the street from Kingfish. So there is no parking there anymore. Most of Coquina Beach parking lots is under construction now for the stormwater project. We're going to need to reach out to the Sheriff's Department on weekends if this stands. That's it.
Sherry, if you could clarify, we're not going to chase people off the beach after 2 hours. It's a parking restriction. It is a parking restriction only.
Correct.
Is that correct, Sherry?
That is correct.
So how are you going to do that? I just got a question.
You get a white mark on your tire.
No, are you going to tow their car?
Sherry, I assume it'll be a parking violation.
It'll be a parking violation.
So you do like Bradenton does with the chalk, and then after so long, then they get, well, we need to make the fines not $10 or $20 because a lot of people will do that. It needs to be higher. I didn't realize that. We're going to have a lot of people be willing to pay the fine to party.
Okay.
Who's laughing?
To clarify, we did not, Commissioner, we did not put any restrictions on what you can take to the beach.
That's what I thought.
You've heard the phrase, the cost of doing business. This will be the cost of partying.
Yeah. Okay. Well, make sure it's not $10 or $20 or $50.
But then again,
Right.
partying's not allowed.
You can party and not drink. I've been doing that my whole life, so.
Again, social distancing still is in effect. People have to respect this social distancing. We still have a governor's order that we don't know what it'll say on May 4th, but we do have requirements for social distancing. The idea is to open it up so people can exercise and be out there for no more than 2 hours. And that's what your parking is allotted for, the limited parking. Okay, Commissioner Serbia.
Yes, thank you. And Commissioner Whitmore, that's why I asked the question earlier, is it going to be a $10 ticket or a $50 ticket? Because I think, yes, some people will agree, hey, we'll just pay the $10, $20 and stay out as long as we want. When the goal is to allow as many people as want to go to the beach that can go to the beach for a short amount of time. I just wanted to say I'm really happy we opened the beaches, and it's these baby steps, just like Commissioner Betsy said. You know, and the governor said, little steps at a time to see how we're doing and if everything is going to be okay. And I think the only thing that can set us back is bad behavior. You know, so I hope that the citizens respectfully, take in all of these things into consideration when they go to the beach. Please, social distance. Please, don't stay longer than 2 hours. Allow your friends and neighbors to use the beach. And if we all just work together, we'll get through this, and it'll be with less pain. That's it. Thank you.
Commissioner Trace?
Yes, just to kind of get off the beaches completely. Had a wonderful thing at Parish Methodist, United Methodist Church last Saturday with their food pantry. It's a tremendous collaboration between Feeding Tampa Bay, the Manatee County Food Bank, the local farmers. I believe that they had 381 cars come through, and they figured that they have fed 821 people just last Saturday. They're giving out milk and eggs. I know they did last night, and I think the rest of the week for a couple hours. And I think they said they had 75 cars yesterday, last night just for milk and eggs. So of all the bad things and the people that are not doing what they're supposed to do. There is a huge amount of people out there that feel strongly about their neighbors and are doing things. They're not waiting for us. They're not waiting for the governor. They're saying, my neighbors are hurting, and I am willing to help them. And I know it's not just this one particular place. They're all over the county. And I just want to tell them how thankful I am. And it's just a wonderful thing. And keep up the good work, because that's how we're going to get through this thing, is everybody working together and just loving their people, that their next door neighbors.
Okay. Mr. Johnson, I got you on the board.
Just, one last comment on the beaches. I think this would be a great beta site experiment for us as to moving to charging people to park. We're going to find out what their tolerance level is to pay. If they're willing to sit there and go 2 hours and pay $50 in a fine, then we can, we'll be able to sit there and go back and, analyze all this hopefully 6-7 months from now. And, I'm just saying that for Carol's benefit, because I know she's a huge supporter of paid parking on the beach.
Okay, you're baiting. So, thank you. I just want to say I was out at Robinson Preserve. I don't know what day is today. I guess I was out there on Sunday, and it was packed. There were a ton of people out there, but we did our best to stay away from people. We took an alternate route, but it's hard because everybody is parking right next to each other. It's very, very tough, but people got to be respectful. People got to yield and move over. And, when I'm on a bike, I try to do that for walkers and vice versa. I mean, you're really going to try to social distance, and we got limited ability places to be outside. You got to make an effort. So, and that's got to be the same for the beach. Try to give people the right of way. Yield. Know that they want a minimum distance. So try to stay away from folks. Try to be cognizant of that. So that's about all I got to say. Sherry, you guys got anything more?
I had one update. I'm sorry, Commissioner Boss looking to comment.
Yeah, she didn't push her button, but I'll say Commissioner Boss. Go ahead. Or raise her hand, I guess is the proper terminology. Go ahead, Commissioner Boss. John?
He's gonna.
Okay. There you go.
I didn't know if I thought we were still on commissioner comments. So
whoever wanted to push button.
Well, I just wanted to mention, I know most of you probably saw the meeting this afternoon between our governor and the president. But the thing of it is that, I felt pretty good about it, knowing that DeSantis, our governor, went to meet with the president to make sure that they were in agreement on whatever it is that our governor is going to present to us tomorrow. One thing I did catch, he said it a couple of times, is that he's going to be moving very slowly in opening up the state. So I was just, I'm glad that they're on the same page, the president and the governor. So I look forward to seeing whatever he says tomorrow. We didn't go back to the skate ramps, skate parks, and I'm hoping maybe in the next meeting we can talk about those. I don't really have any, I don't think, in my district, but I know that, we have heard from a lot of people on them. So just wanted to mention that. And the last thing I want to say is I purposely, I did not send my chair an email about her withdrawing from running for re-election. I wanted to wait until the meeting today to do that. Betsy and I, a lot of you probably don't realize that we ran together in 2012 in that race, and we saw a lot of each other when we were running. We also had our victory party together the night that we both won, that put us on the dais together. And I just wanted to say it's been an honor serving with you, Madam Chair, and I will miss you. Believe it or not, I will miss you.
I'm not done yet. I get to go to November, but thank you.
Well, I just wanted you to know that I will miss you when you leave. Thank you.
All right. Sherry, do you have anything else?
I just had a follow-up for the board, from President Galvano, some three items that his office has sent in based on some communication today with commissioners. One, he's confirmed that the regional Manatee Sarasota Test Center is now being planned, and the details will be announced, so they're coordinating with our local incident command team. So it will happen. We're just waiting on the dates and the times. Two, in addition to the regional testing site, President Galvano's office has announced that another 1,000 collection kits will be delivered to Manatee County tomorrow. Manatee County leadership, Manatee DOH, and will allow us to determine how those tests are to be provided to the public. So thank you for reaching out to him on that. And then three, President Galvano has also a separate request in with the state leaders for test kits dedicated for the homeless of our community, and hopes that details on that request can be announced later this week. So that's a good shot in the arm for the additional testing. Thank you.
Well, that's wonderful. We really appreciate Senator Galvano tuning into our meetings and helping us every single time. We couldn't ask for a more responsive senator, so we really do appreciate everything that he's doing for us. All right. Mickey, you have anything else for today's emergency meeting?
No, ma'am.
All right. Since we have, when is our next meeting now? It's May
5th, next Tuesday. Yes, we have a
Regular
meeting
meeting,
next
May 5th.
Tuesday, 9 o'clock.
Okay. All right. Well, then this meeting is adjourned, and we'll see you all. Oh, Carol, you raised your hand. Did you want to say something before I adjourn the meeting? Okay.
No, we're waving.
Oh, okay.
Same here.
This meeting is adjourned. We'll see y'all next week. Bye.
Thank you. Thank you.